Check, check, check. Look at that, we're powered up. Welcome, ladies and gentlemen, to day 2 of HealthTech Week 2026. Come on in, we've got our first session starting up, first session of the day, bright and early.
Check, check.
Oh, who's beatboxing up there? Oh, I like it. You got our intermission show. Okay, Pankaj, let's get going. We've got your slides up on the screen.
Yeah. Check. Good morning, everyone.
Morning.
Good morning, everyone.
Morning.
How much time?
Good morning.
Are you on?
20 minutes.
Okay, we'll start counting up.
All right. Are you guys awake? Yes? I'm going to wait until you guys wake up.
Okay, how was the yoga this morning?
I went to the nightclub this morning. Oh, sorry. I went to the venue from last year, and nobody was there.
So we can't see your face, Pankaj. Oh, there you go. Sorry it's so bright, but you look great on TV.
Okay.
Yeah, he thought it was last year. We had a little time machine issue, right? You went back in time to last year when we were up on Broadway?
Yeah, I searched for Steve's name in my email, and I found his email. And it said venue is 435 Broadway. So I got there in time, but I'm here. Okay, let's get started. So when I talked to Steve a couple months ago, we actually called this the fast-moving decade. But as I've been thinking about this, we are really in the AI century. And I was in New York over the holidays. As I'm going to the airport in Times Square, I see this. Have you guys seen this? This is Anthropic ad. Incredible, right? So the question is, what problems are we talking about? And this is what we live with today. On the healthcare side, 3 million people, 3 million, die every year because of doctor error. 250K die just in the US. Not to compare, but 9/11, we lost 3,000 people in New York. But we don't talk about 250,000 every year. By the way, I'm getting an echo.
Yeah, we're hearing it. It's good. Here it's good. You look good, you sound good. Yes, keep going.
Okay, all right. And you can look at different statistics, right? The amount of waste, 50% diagnosis rate. This cannot be acceptable to us. Most of us are in Silicon Valley. We are living in good times, we are making good money, we are coming to these conferences. We need to think about this. And then the other side, if you think about mental wellness, as I was doing my research, I was horrified. We have 8 billion people around the world, 1 billion. In the US, that number is 60 million, like 1 in 5, 1 in 6, living with mental wellness challenges. Who wants to live in this world? Anybody? No. 1% doesn't want to live in this. So what I'm going to share today is my perspective on how AI in this century, if not in my lifetime, in this century, can take every one of these numbers to zero. And we often talk about we live in sick care, not health care. We live in reactive, not proactive. We live in fragmented times, not personalized times. For the first time, AI has the potential to turn every one of these red things into green things. So I had a long career starting multiple businesses at Intel and Qualcomm, and then I decided to become a full-time investor. And as an investor, you don't think about this week or this month or this year or even this decade. You have to think long term. So I'm like, let's go back 3 billion years. And this is how the population grew. This is how GDP grew. This is how technology made GDP growth and population growth possible. And while the world we live in is 3 billion years old, 99.999% of things have happened over the last 300 years. So if we look at the last 300 years, we started with the Industrial Revolution, and we had steam engine and railroads 100 years apart. And then we got electricity. Can you guys imagine if we did not have electricity? Right? These were game-changing. But if you look at railroad to electricity, it's 50 or 75 years. And then we saw the information revolution, PC, internet, mobile, cloud, much, much faster. And now we are in the AI revolution, intelligence revolution. And when we say AI is bigger than anything we have seen, it is not an exaggeration. When we say AI is moving things faster than anything we have seen, it is true. I was on a panel last night, and I just came up with the new AI law. Moore's law, I grew up with chips, semiconductors. Moore's law was 2x transistors every 18 to 24 months. AI law is 2x revenue, doubling revenue every 6 to 9 months. That's what we are seeing with OpenAI and Anthropic and all the AI native companies. So things are moving much faster. And we live in the best of times, because just think about this. In my lifetime, I would have lived through 4 revolutions, right? I cannot see you guys, but some of you would have lived through 4 revolutions. Jay and I would have lived through 4 revolutions. That's incredible. And so it's good to look at the past, but future is more exciting, actually. If you look at the global economy, Netscape IPO happened 30 years ago. In 95, the global economy was only $30 trillion. Today, the US economy is $30 trillion. The global economy has gone up by 4x. So end of last year, we ended 120 trillion. Over the last 30 years, thanks to internet, mobile, PC, cloud, we went up 4x. If you do the numbers, nominal growth was 4.7%. I kept inflation out just to keep things simple. But if you look at the cumulative economy over the last 30 years, it's 1,900 trillion. So when we talk about $3, $4, $5 trillion of investment in data center, and people say we are in a bubble, I don't know what that means, right? It's like moving a chair on a Titanic. These are actual numbers. We cannot debate with facts. The question is, what happens in the next 15 or 30 years? To keep it simple, I'm going to focus on the next 15 years. And let's assume, because of AI, we maintain the same growth. I can easily make the argument that AI will add a few percentage points, but just to keep it simple. Same growth rate, 4.7%. In 15 years, the global economy doubles. We can debate after my time is up, if it is 3x or 4x, right? And if you look at the healthcare slice of that, in 95, 1 out of 10 was healthcare. Today, 1 out of 8 is healthcare. In the US, healthcare is 1 out of 5. US is 30 trillion, healthcare is 6 trillion. And if we don't do anything, healthcare might become 1 out of 5 or 1 out of 6 globally. Right? But we are talking about big numbers. 15 trillion last year, going to 30, 40, maybe even higher over the next 15 years. Healthcare is not the biggest sector of the economy. Manufacturing is, retail is, financial services is. Healthcare is number 4. But you know what? Internet, mobile, cloud have penetrated financial services on a global basis. Technology penetration in financial services is 40+%. In retail, in manufacturing. But do you know the adoption in healthcare globally? It's between 1 and 2%. So actually, the upside with AI, with technology, is highest in healthcare. So the opportunity is big. The question is, how can we leverage AI to transform healthcare? And this week, you go to consulting firms, McKinsey, BCG, Bain, you go to banks, JP Morgan, Morgan Stanley, you go to tech companies, NVIDIA, Google, Microsoft, you go to what we think of as startups, OpenAI, Anthropic. Every one of them, the number 1 vertical they are pursuing is healthcare. And OpenAI just came out with this report. We are already using ChatGPT to ask questions. We are using ChatGPT. 7 out of 10 of us are using ChatGPT when we cannot get hold of a doctor during working hours. And 600K are using in underserved communities. So it is available, it's accessible. 2 out of 3 physicians are using ChatGPT. 1 out of, or 45%, 46% of nurses are using ChatGPT. This is already happening. The question is, what can we expect over the next 5, 10, 15 years? And this is kind of a framework I use in my work as an investor, as an advisor. You go from top to bottom. You start with research, wellness, all the way to drug discovery and drug delivery. And if you're going to remember just one thing, just remember this framework. In the short term, there's a lot of focus around research, around non-FDA things, around digital health, around wellness. And I call that automating what already exists. Right? So the data exists. I just want to do it faster, better, cheaper. The workflow exists. I want to remove inefficiency, do it faster, better, cheaper. People will lose jobs when you do things faster, better, cheaper. And there's a lot of focus on this. But actually, the bigger pot of gold is the next evolution where AI will do things humans cannot do. AI will solve cancer and diabetes. AI will give us personalized medicine. AI will give us early detection. We have not been able to solve those things. You know, in the home of Waymo, if Waymo were just as good as humans driving, 40,000 people die every year because of driver error. 40,000 people will die with Waymo if it were just as good, right? The goal of Waymo and Tesla and self-driving robotaxis is not just as good. It is take 40,000 to 4,000 to 400 to 0. So when we talk about new use cases, it will take longer time. A lot more that is at stake. Data becomes increasingly important. But that's where the big opportunity is. So founders in the room, if you're working on an app that shows me how many steps I took or creates a headshot using Gen AI, you're wasting your time. You're wasting your talent, right? If you're working on things that humans cannot do, that's worth pursuing. That's worth investing. In the short term, we'll make some quick money, but that's where the opportunity is. I saw a very good report from Menlo Ventures. Anybody here from Menlo Ventures? No. I would encourage you to look at this report. It's on the top left. State of AI in Healthcare, October 25. And this slide I borrowed from that report. Basically, it says, you know, healthcare has been, in the 20th century, in the dark ages, technology has not, penetration of technology in healthcare, no matter how you look at it, hospital systems or on the payer side, on the insurance side, has been 1 to 2% penetration globally. In the US, it is 5 to 7%. But for the first time, AI adoption, AI deployment, healthcare is leading. If you cannot read this, the black line, the line at the bottom, is average across all sectors. And then the other lines is different aspects of healthcare, right? And by the way, the modern AI, Gen AI, it's been only 3 years. Much of this is Gen AI and ML. So for the adoption in healthcare, in a regulated industry, to happen so fast is incredible. If you look at the next chart, it basically says this is not isolated just on research or just for payers or just for hospital systems. It's happening across the board. It is creating new markets. And for founders and investors in the room, this is where the next trillion, 10 trillion, 100 trillion company will come from. And we are seeing the first unicorns. You know, OpenAI and Anthropic get a lot of air cover, but these companies are disrupting healthcare. 2 more slides. I'm all in AI. My biggest focus is at the intersection of AI and healthcare. And I use healthcare liberally, life science and biotech and pharma and so on. I invest from silicon all the way to applications, but healthcare is my biggest portfolio. I have about 30 investments across the board, right? So any founders in the room, catch me. My prediction, my time is up. Last slide. My prediction is today, most of us are like, if a doctor uses AI, I don't know. Somebody might sue the doctor. My prediction is before the end of the decade, if the doctor is not using AI, he or she will get sued. Because AI will improve every aspect of healthcare, right? So my request to all of you is, this is the AI century. This decade is super important. We have seen what has happened over the last 2-3 years. What we do over the next 5 years will determine how we live for the rest of the century, right? So if you're an investor, pursue, use your dollars wisely. If you're a founder, don't do an app, solve big problems. And if you're coming from a big hospital system and enterprise, we are seeing significant benefits of using AI. Okay, my time is up. So thank you very much. I don't think we have time for questions, but I'll hang around for...
We can do a couple questions. Yeah? So let me get another mic runner and raise your hand if you have questions. Who's got a question?
Can I ask questions?
You can ask questions. Can I answer questions? Okay, yeah.
No, don't be shy.
Well, we ask your question and then we have another question.
Yeah, go for it.
So I saw the slide of the 20% on the top. Is that a global thing or is it just the US market?
Yeah. Now, we live in a global world. Everything we do here in Silicon Valley is not just Silicon Valley. It will have impact globally, not discounting, geopolitical China things, etc. So everything I presented is mostly global. 2080 is global number.
Thank you.
Pankaj, what question do you have?
I was just kidding, because if I say I have a question, then people will raise their hand.
Oh, we have another question.
Yeah.
Hi, I'm Dipali Saxena. I'm a radiologist now exploring AI in healthcare. Going forth, what areas in healthcare do you think specifically are going to move forward faster
Yeah.
in the decade rather than over few decades?
Yeah. Dipali, do you have kids?
2.
Which one of the two do you like more? But Dipali, 2 comments. 5 years ago, one of the very famous AI godfathers of AI predicted that with ML and AI, radiologists will go away because AI can detect, and you don't need radiologists. And Jensen from NVIDIA tells the story better than I do, so I'm borrowing it from him. Actually, the number of radiologists has increased, and there is almost a 90 or 100% attach rate of radiologists using AI to read the images. And when AI is reading the images, the radiologist becomes more important and can ask the question, answer the question. So what does this mean? Right? Because you introduced yourself, that's very interesting. All this discussion about AI taking away jobs is crap. Now to your question, Dipali, I have a difficult time picking one area. And so my way of thinking about this is, in the short term, it's what we already do, faster, better, cheaper. That's like easy win. In the long run, whoever cures cancer and diabetes, in the US, there are 60 million people with diabetes. 30 million don't know it because you cannot detect it early enough, right? And I can say that for many diseases. So in the long run, the big challenges, that's where I would focus on. As an investor, I don't invest saying, where can I get the fastest win? Which startup can be successful by 2030, right? The question I ask is, what if his vision comes alive? What impact will it have in the world, right? And if that takes 15 years, that's okay. So that's how I think about it. So I will prioritize those buckets. But within those buckets, you might have a different priority than somebody else here. Yeah.
Pankaj, thank you very much for getting us kicking off the day here. I really appreciate it, and next year we'll keep the location a surprise till the very last minute.
Okay. Thank you, everyone.
Big hand, everybody. Okay, now we have very special guests. I want to just welcome up, and Peter Dannenberg brought some special guests. Can we get the all screens? Get these folks up on the screen so we can see who's coming up. And we're going to put Peter in the middle. I know it's confusing when you have multiple Peters in the family. I wonder how that was growing up.
We did it to avoid confusion.
Your dad says you did it to avoid confusion. Here you go. Let's get each person a microphone. So how did this panel come about? I'm trying to recall our initial conversation. I invited Peter to speak. You've been with us at a number of events, so I really appreciate you. Peter Dannenberg is senior engineer with Google DeepMind, and we've been doing this for over a year now with different events.
We had a few adventures. There was one in South Korea, and what else did we do? I think we did the media one, and was it San Mateo?
Yeah, media and entertainment. We'll be doing more AI and media entertainment coming up. So that's one of, for people that know AIFI and what I do, I'm really passionate about both the sciences and healthcare, as well as the technology behind entertainment. So we did an event there, and then I didn't know that I mentioned this event, and I didn't know that you were into the bio part.
I mean, so the strange thing is, so I grew up, and so my dad's a professor, and my mom, I guess, would you say serial entrepreneur? I don't know how would you describe it, but in any case, growing up, the constant in my life was always essentially biochemistry at the dinner table. And anyway, my folks have kind of an interesting relationship. Bob, you basically used to write the grants, and then Mom would do the work, right?
And let me, before you answer, Senior Peter and Peter's Peter, just want to set the stage. So meet the Dannenbergs, everyone. We have Peter and his folks.
Thanks so much. But so Bob, you used to write the grants, and then Mom would do the work, right?
Yeah,
So,
right. I did the easy part, she did the hard part. Basically, I tried to come up with the good grants so we could do so to provide employment for myself and my wife. No.
Oh, closer.
Oh, there. Sound like Zeus or something. Okay.
But the interesting thing growing up, so my folks would do research together in the lab. My dad you taught at USC for what, was it 40 years? 45 years. So now emeritus. But I saw this interesting thing where my folks would do research together, and then my mom would commercialize it, right? So you commercialize some of the things that came out of the lab, right?
Yeah, we developed a couple of things that didn't exist.
Yeah.
Which way? This way?
Yeah, there you go.
Okay. Yeah, we developed a couple of things that didn't exist. First, the RNA from paraffin tissues, so that patients didn't have to get biopsies anymore to get gene expression or DNA sequencing. Did a lot of work there. We started a company, took it public, Response Genetics, and we're able to set up labs around the world in the EU and China and Japan. Peter had at that point write the code so that we could associate the results with the FDA and the pharmaceutical company.
So what was it? Was it difficult working with China because you couldn't take any of the was it any of the samples or any of the
Well, they
data
didn't
outside
let
the
you.
country?
You can't bring samples out of China, patient samples. So basically, you have to analyze them there and get the results there, and then you have to depend on them doing it correctly for Pharma and for the FDA here, which was a big ask. Sometimes if they got a sample that was a patient, a tissue sample that was too difficult to microdissect, they would just throw it away, and that would, ding the clinical trial for one of the biggest pharmaceutical companies in the world. So we had a lot of stress on that. We had a lab in Japan also, and then a lab in the EU, and then coordinated and did some FDA work with that. But that was tissue, and we did that for years and years, and had a public company on that. And finally, after they decided they wanted to, sell the company, I started a company in blood, liquid genomics, and we were able then to pull all the information out of blood, which is really critical. We could do, complete genome sequencing from a blood sample. We could track patients through their therapy and watch tissue samples, go. Blood samples have higher and lower expression of various genes, which is really important. We published that last year, I guess, finally.
But it was a little bit ahead of its time, right? And
Yeah, it's ahead of its time, but we were working with China. One of my top guys went to China, so they did the whole thing anyway in China again, and then we were able to collaborate with them and show that the blood work matched precisely what the tissue samples were. So
The basis for the blood work was that it was discovered around the turn of the century that tumors, for some reason, dumped all their nucleic acids into the bloodstream, and so if you could assay those and show that they reflected what's going on in the tumor, that'd be a huge breakthrough, because then you wouldn't have to get wet tissue samples from, taking pieces out of the patient. Just take a blood sample. You can do that as many times as you want, and whereas take a biopsy multiple times, it's difficult for the patient.
And also the changing, so the whole dynamics of it, it's not just a one-time sample. You have to see what's going on over time and whether a gene expression is increasing or decreasing. And I don't think it's really picked up. We moved up here from Southern California, and I'm going to Stanford now to various doctors. I'm trying to find out whether they're doing this.
But the basic idea is that instead of coming in for a difficult tumor sample, you can come in for a blood sample.
Yeah.
You can figure out whether you have cancer, whether your cancer is progressing,
Yeah.
or you're sort of doing, and you could probably do that every day.
And you can mail it in, because there's blood stabilizers now. Streck produces an RNA and a DNA one. We were the only one that was able to use their RNA one, but we developed a technology, and you can mail them even from overseas. So
That's amazing.
samples. So it's really, really works. So I asked ChatGTP the other day, if, who up here at Stanford might be somebody that we could still talk to. And I
Hey, Brent, how are you?
should ask Gemini at the same time, but I didn't have that.
So, my mom does ChatGPT, and
I know we shouldn't do. Well, no, we do both. We do both. But yeah, they did give me a few labs that are starting to think about RNA finally. I mean, years after we generated the documents on, how well it works. So I think that's the wave of the future. Everything is right there. But the main thing is you have to look at it dynamically, not just a one-shot, diagnosis, because when things go up and go down, it's really meaningful for patient survival.
I mean, it's interesting to me that there's been so much resistance about that, that people still want to go to the tumors. But in any way, the funny thing is, so growing up, so this was kind of my table talk at home, right? And then, so my mom and I guess we worked on a couple startups together. So we did response genetics, we did liquid genomics. But anyway, the funny thing is, so I was doing the coding, you were doing the lab stuff, and response genetics was this funny thing where I think I was the sole engineer.
Yeah.
And so somehow I had to control everything from the lab robots to the HIPAA system to the report generation thing.
And the pharma company data
And the pharma
that they
company
needed
data.
for running trials with us.
But anyway, the funny thing is I can't really describe this experience, but I just remember as I was writing the code, I had this idea that if I screwed up, there's a little typo, a little bug, that somehow people's lives were at stake, right? So maybe I would sort of subtract 6 weeks from somebody's life. Worst case, if I got this wrong. And I'm thinking about that if we did it today and I vibe coded all this stuff, God, I don't know what that would be like. In some sense, I'm deferring to the LLM to basically save people's lives. Maybe, I guess. But the problem with the vibe code is that you don't actually know what's in there. So, but I think when we were doing the pharma stuff, all the code had to be audited, right?
Right, but it had to be, really well validated. I mean,
That's
there's massive validation systems when you're dealing with pharma. So it was a chance of, having some wayward code, would be found out pretty quick before we started, I think.
But, I wouldn't be shocked if they're using LLMs to do the validation now. So you have LLMs write the code, you have LLMs validate it. And the funny thing is that LLMs are friends, So I was reading this funny article a couple of months ago where I think they had some LLMs evaluate some stories. And for whatever reason, when an LLM wrote the story, the LLMs would evaluate it much higher. So LLMs tend to prefer LLM's company, which is funny. And but in that case, I wonder if the LLM is vibe coding the lab stack, whether the validating LLMs will just kind of let it pass. I don't know, but I don't know. Maybe we should do another startup. Maybe we should.
Yeah, we should do another startup. No, we had we did our own validations, of course.
That's true. That's true.
But our own validations might not have been as quite as strong sometimes as what you could do with the LLM. Yeah.
Wait, so because you had a human that literally had to go through
you have
every
human
row.
validating human work, and it's just maybe you have human work there, and you have LLM validating it with real, just discerning exactly what's going on. But there's structures for that, and you have.
So, but in terms of this validation, what would the human actually do? So they would go through a spreadsheet row by row and just see whether there's any strange-looking numbers.
Validation is doing it one day and then doing it the next day and doing it the next day and having multiple operators, multiple machines, everything, doing the same thing, seeing how closely it associates. So you would still have to have probably the humans temporarily doing from machine to machine and person to person.
have humans carrying the samples from machine to machine.
I mean, so like coding nowadays, humans essentially just copy and paste, between different. So that's the physical version of copy and paste.
Right.
But for some reason at the Gemini meetup, this comes up every once in a while, and somebody's asking, "Hey, listen, who thinks your job is safe for the next 2, next 5, next 10 years?" But I guess the guy that carries the samples between machines will be safe for a couple of years, huh?
Unless
No,
they
no,
get
you
it
have to
all-
re-extract samples. You have to start from the beginning, but it's a multiple people, multiple machines, multiple, it's definitely a set that looks, pretty strongly capable of an LLM reviewing, I guess, the data pretty well.
I mean, this was one of the funny things, and I remember, so when I was programming this like laboratory stack, one of the difficult things was in my mind somehow I had to keep all these relationships. So I had to think about the fact that I'm dealing with doctors, pharma's people, lab people, sort of us as users. And to keep that context as I was coding was a little bit difficult. And, one of the challenges that I have working with LLMs is just the context management. And I wonder if it's one of those things where, let's say you are doing something like a lab stack today, whether you do need to have a human in the loop that has this sort of full picture. And, maybe you can delegate it out to individual agents, but my sense is you probably have to have somebody kind of in charge who understands the
Everybody
tension.
has a Janine like I have, my Janine stayed there for 13 years or 15 years and watched, had to run to Tokyo or to wherever, when things weren't working exactly right, but you have a person there that, has to oversee.
Well, so anyway, so maybe can you guys talk a little bit about some of the research that you did? You guys had a few patents. Mommy said you're getting citations as recently as last night. What kind of work did you guys do?
I mean, at the beginning, we did, we were the first to extract RNA out of paraffin tissue. They thought RNA is expression of genes and DNA is mutations of genes, but they both probably reside, you'll see it in the RNA and the DNA. So we focused on RNA, which is really the most dynamic molecule in the blood as far as what happens to, with a patient.
So, but why is RNA out of paraffin difficult? And then why basically, how come, I mean, everybody tried to do end runs around our patents.
Everybody
So why is
tried
it
to
so
do
difficult?
RNA out of paraffin, but then a lot of people stopped because it's supposed to be a real
So
not
Kathy,
stable molecule.
so the extraction of RNA out of paraffin was a breakthrough.
Right.
Okay, there was 2 breakthroughs. There was an invention of the PCR, which we didn't do, which I hadn't done. And then once you get the PCR, you have to analyze patient samples. So to get wet samples from patients is difficult, and you can't do big studies like that. You have to get a sample shipped from Europe or something to fresh frozen. It's difficult. So
RNA, they're in paraffin.
when a tumor surgery is done, what they do is they embed a specimen in paraffin, and that stabilizes it. But there was no way to get stuff out of there that was known until recently. So we showed that you could extract RNA from paraffin.
Yeah, but then
And do
very,
the PCR on it, and that was a breakthrough.
Yeah, but does everybody know what PCR is, by the way? Has anybody heard of PCR? Oh, we got one. Okay, a couple.
Oh, sorry.
You want to tell them what PCR is? Or no?
Okay, PCR is the polymerase chain reaction, and they use it for testing blood samples from crime scenes or whatever. Anyway, what it does is it amplifies segments of DNA, and it allows you to do an analysis. So it's actually practical study where you get tumor samples from patients if they use little bits. If you can use archival paraffin embedded specimens, that opens up like millions of archival samples you could analyze.
So basically, there was all this stuff sitting around in paraffin. Nobody could do anything with it,
Right.
and then your RNA out of paraffin thing unlocked
right.
essentially millions of samples, right?
But the next big breakthrough was that you need to be able to get it out of blood. And Streck came up with different, they were new. They have blood testing tubes that have stabilizers in them, but nobody could get RNA out of blood except for us. We were able to pull that off, and now we don't really need the tissue samples. We can take the biopsy straight out of the blood and analyze it.
So basically, so you're saying the 2 big things: RNA out of paraffin, RNA out of blood.
Right. That was
And people are still bearish about RNA. People they're bullish about DNA for some reason, right?
Well, I mean, we
So-
got us, we did the first genomic sequence, whole genome sequence years ago here with UCSF, and in pancreatic patients, we got really a reading of, what what it looks like. And I get so many, I mean, thousands now of citations for that. Even this morning at 2 o'clock in the morning, I got another citation on that paper that we did on whole expression of RNA. So that was out of tissue in the old days, but now doing it out of blood, we kind of stopped at the end of that company. But nobody's really pushing it right now. I'm going to go into Stanford, I guess, and talk to some of those labs that the other AI company told me is starting to try to work on RNA from blood. Streck, the company that actually makes the blood sample tube, couldn't generate it either. So I think that's the next big step. We need DNA, we need RNA, because we need to see the change over time with RNA. That ends up matching the tissues. So we did a big study with China where they did and they have AI there too, I guess. You know, they read the whole thing and did it out of blood also and came out the same. So we're excited about the next steps.
Oh, so there was a question about why RNA, what's better about it than DNA? First of all, DNA is it on machine really fast now. It gives you all the mutations that are present in the DNA, but a lot of tumors depend not only on a specific mutation occurring, but on enhanced gene expressions of certain genes. They need more activity of certain genes, like I don't know, I can't think.
Well, the RNA goes to the protein.
The RNA the level of RNA indicates the level of gene expression. So that's what we want to do with in the case of the enzyme we're studying, thiamidylate synthase. And RNA also gives you the mutations that are, what's the word?
Expressed.
The critical mutations. DNA sometimes has superfluous mutations, so that confuses you, but RNA has only the important ones. Otherwise, they wouldn't be there. If they were unimportant, they wouldn't be in the RNA. So anyway, so there's two advantages but it's more difficult. RNA is unstable, and you have to take special precautions with special techniques, and that's what we were working on for about 5 years.
Yeah, but with blood, we were able to do it, you know, when we went to Nant, actually, one of Patrick Soon-Chung's companies who actually bought Liquid Genomics at the end, we took it there. And we were able to get every single sample we got from all over the world in blood. He just started to go on to another drug that he's developing, you know, beyond that, but
Well, so one of the things I was trying to figure out, just because I remember growing up, Mom, you'd be in the lab until like 2 or 3 a.m., and I think you were sort of cranking some of this stuff out. But one of the things I'm trying to figure out, and this may be relevant in the age of LLMs, is how do you come up with scientific hypotheses, and then how do you test them? You know, so people bring up right now, you know, LLMs supposedly they're going to help us generate these scientific hypotheses, but how did you even get the idea of extracting RNA from paraffin and all that business? And then how did you do it? Was it just staying in lab every night till 3 a.m. and just trying a bunch of different things? You know, how do you? What's the process of like scientific creativity?
To the point that you couldn't do it, it wasn't able to be done. RNA is too unstable. You can't get it out of paraffin. Once you treat it with formaldehyde, as they do, and paraffin embedded, it's never going to work. So I tried everything I could think of over and over and over again, and of course none of it worked. And then I was sitting inside, looking in this. You have hoods in biochemistry, and you work behind them, and it was a Christmas party, so some guy came up behind me and said, "What are you trying to do?" You know, and I said, it was kind of semi-drunk probably. I said, "Well, I'm trying to get RNA out of paraffin." He says, "Well, why don't you just heat it up?" Of course, you can't. Everyone felt you couldn't just heat up, RNA. It's not stable enough. So, I didn't actually go heat it up. It was kind of a joke, but then one night I took a sonicator and I put some glass beads in there, and I did try the sonication to get it out gently. And I set the sonicator on high instead of low, and it blew this stuff out of the tube and heated it up. But I put it away, and then the next day I tested it, and I found out when I heated it up actually worked.
But
But you have to heat it up in the right solution.
Yeah.
I got RNA out of it so we had to file the patent at USC and took that on, but I had to give the guy who came by the hood and told me to just heat it up, part of the patent.
So that's the thing is I don't know how well LLMs can mimic the drunk guy at the Christmas party, right? I mean, if you turn the temperature setting up to 1, maybe 2, maybe you can sort of get drunk guy at the Christmas party level of creativity. But I guess, that's going to be interesting to me, whether these LLMs are good scientific companions and whether LLMs can say, listen, bro, please just heat up the paraffin. I don't know. I guess the jury's still out on that. We'll see what happens.
They have to say, try anything.
But that may be like alcohol-induced, like thinking out of the box, right?
Yeah, I mean, that was an accident, so but I was smart enough to keep all the tubes and.
But I think literally all scientific breakthroughs are usually accidents, right?
I don't know.
Sometimes.
Maybe. But I do think that, that anyone could have tried that over the last couple of decades, and they didn't because they were afraid to do it. LLMs maybe won't be afraid to try something that sounds a little crazy.
Well, on the other hand, though, they've been trained on sort of what exists. So it'll be interesting to see whether LLMs can sort of suggest things that are, out of band or whatever they call it.
But analysis of the huge amount of data that you get, humans can't really do that.
That's true. No. I think for that sort of thing, summary, it'll be fantastic.
Not fast enough to treat patients, that's for sure. You need somebody that can go over the whole, set of genes. Instead of having this tiny little set of genes that you analyze, you could just do the whole thing if you're an LOM.
Yeah.
And you'd find, what's going on with your patients. And
no, I mean, that's one of those fascinating things is that the human genome, it sort of resembles a language. And not only the genome itself, but nucleic acids and proteins, they all have this sort of language-like structure that LLMs know how to deal with. And so anyway, I'll be curious to see over the next couple of decades if LLMs help with drug discovery and that sort of thing. And I don't know, it should be some interesting times. You guys have anything else? Or anybody have any questions, by the way? Just out of curiosity. Oh yeah.
This is fascinating to hear, like the dinner table conversation from yesteryears.
Yeah. Yesteryears.
Hi there. My name is Mario Sierra. Question around like in silico research with LLMs. Like, how do you see that evolving with DeepMind and other AIs out there?
Oh, and so sorry. Did you say in silico?
Yes. So like modeling biological environments and being able to do stuff like drug discovery or biomarker discovery. Like I said, insofar as those things are language-like, I think there's going to be really, really interesting potential. And then I think the only difficult thing is, and the LLMs might be able to help here, is that eventually you sort of have to get into the wet lab, right? You can't sort of avoid it. And I think that goes for things like drug discovery, even things like, just compound discovery and that sort of thing. So if LLMs can help with let's say the discovery process and the pruning process, so that the actual things that we have to take to the wet lab are fewer, further in between, I think that'll be huge. I don't know. I'm cautiously optimistic or whatever. I'm usually a little bit bearish about these things, but I don't know. I feel like LLMs might be able to pull something off. That's just my gut. What do you think, Mom?
Yeah, no, I mean, we have to be able to analyze all the data when we do. Just like in the old days, you're analyzing 10 or 12 genes. You need to run the whole thing every time.
Yeah, you're right. You're right.
And then you'll find out what you're doing right or what you're doing wrong, especially with treating patients. That's why I'm happy to hear that some people at Stanford are now finally, after we did this years ago, just starting on the RNA out of blood. So I think I can go in there and help them out some.
No, that's great.
And they do have the patient, groups there to test.
Oh, that's great. No, thanks. Anybody else?
More questions? Come over. We got another mic runner. I got that one.
I grew up doing the same stuff you guys do, but the question I have, given these models and their capabilities and what we're talking about, I have 2 kids now that want to go into STEM. How are they going to navigate jumping from their early sort of getting out of college to that high-level person that can use the LLMs to design their experiments?
Oh man, yeah, that's a tough one. So I talked to my folks about this, and maybe Papa, you can talk about that. But there's this idea of the 10,000 hours, right? And I don't know. My gut still tells me that in order to do good science, at some point you have to put in your 10K just to get an intuition for nature and how things work, and to be able to generate these ideas. And that's what I was trying to figure out from you guys. Like, how do you, when you're doing science, Pop, how do these ideas come to you?
That's exactly right. You have to immerse yourself into the field. You have to look at studies of previous people. Like somebody said, you're on the shoulders of giants and all that stuff, And then, after thinking about it for a long time, you arrive at a hypothesis. It kind of sort of suddenly, sometimes it pops into your head, you know, all of a sudden, like an epiphany, like, holy, that's it. Other times you kind of not like an epiphany, just arrive at it logically. But then, you know, then you have to test it. You have to use a scientific method. You do the experiment, and then if it looks like it's working, then you try to falsify it, you know, to test it, whether your findings are true or not, supporting a hypothesis. But basically, there's no getting around to putting in the time to study the field, get the background, propose some hypotheses based on, you know, incomplete data, which are reasonable, and then you have to test them.
But you don't have to, but if you could test them using LLMs to develop the data, you could spend your whole life developing the data from the whole sequence of, you know, your population of patients or whatever you're doing. I think it would be much quicker if you had the huge amount of data that could be analyzed in a
More data is always good.
So I guess my only question is, let's say you skip to 10K hours and you go straight to the hypothesis generation part. Let's say you never get a chance really. And, you know, when I talk to kids today, sometimes I ask them, I said, listen, do you feel like you're actually getting an opportunity to learn how to write or learn how to think or learn how to do whatever? And actually, most kids tell me they don't, since they feel compelled to go to the LLM out of something like peer pressure. Because by the way, if they don't, all of their other peers are going to be writing code and essays and whatever at a breakneck speed. They feel compelled to skip that 10,000 hours step. And if you do, I don't know if you can be in the hypothesis generation business, you know, because somehow, so maybe if you rely on the LLMs for hypothesis generation and all that business, maybe that's okay. But at that point, I don't know if we've cut ourselves out of the loop. But I think you have to spend the time to be able to generate the hypotheses, right?
Definitely.
Yeah, I don't know. So, you know, there are these funny kids that I meet, and I want to say,
you have to support a hypothesis, so you definitely have to know what you're talking about to rationalize it to other people, especially if you want to write a grant to study your hypothesis, you know.
Well, you know, that's another thing too, because so this friend of mine said he went to ChatGPT and said, man, ChatGPT solved the fusion problem, right? And so he showed me this conversation that he had. And here's the thing: if you, you know, maybe if you're ignorant of nuclear physics and you read this thing, it sort of sounds plausible-ish, right? And so that's a problem. So let's say, you know, you dispense with that 10K hours in nuclear physics or whatever. How can you even evaluate the hypotheses that the LLM comes up with? And so maybe you need an LLM to evaluate the hypotheses. And anyway, it just be sort of LLMs all the way down. But yeah, this is one of the huge, I think this is going to be one of the huge problems that we have to deal with. And I was just going to say, you know, sometimes when I'm talking to these kids, and this is maybe more like a Gen Alpha thing, like about 1 kid in 100 absolutely refuses to use LLMs, somehow heroically resists like the siren call of LLMs, and he's like Odysseus tied to the mast or whatever it is. Maybe that kid is going to be the one who sort of does fusion or whatever. But anyway, that's a great question. Anybody else?
More questions. I know there's questions in there somewhere.
Yeah, I'll link it together. I mean, LLMs are like the first level, but the main thing is like physics equations and math equations, and that's kind of the third level. And what the whole process with AI is able to do is link all these things together. So I remember taking electromagnetism, but with Matt Sands, who was like Feynman's best friend, and he wouldn't give answers, and he'd have like 5 linked problems to solve it. And I think AI would be good at understanding, okay, this problem, this one, and trying all the possibilities and seeing how to get to the end. And so like in mathematics, they used it for knot theory and they derived 250 million different knots, but now it's used in protein folding. So I think as we evolve, we get to higher and higher levels. And the research that you're doing is fundamental for building these building blocks. And then AI will kind of help put some of these building blocks together in the right configuration.
Well, then, you know, by the way, Brent, that's probably one of the best arguments I've heard for these huge, expensive, slow models that we have, is that they're going to have this AGI-ish ability to kind of link these, let's say, these distal concepts. because a lot of the startups that I talk to and a lot of people now, they're going towards these kind of lean language models and this sort of constellation of small models. But I think you need the big ones to do the sort of thing you're talking about, where you're you're creating these non-obvious kind of emergent links. But yeah, that's great, Brent. Somebody else?
Yeah, Kathy, Peter, and Peter, thank you for coming. This is fascinating discussion. The question I have is more personal. So for Kathy and Peter, how was it growing up with Peter at home? And what was Peter doing when you were doing these crazy things? And Peter, how was it for you with your parents? Just a little personal story would be amazing.
I mean, for me, just I used to play in lab, so I'd invent all these games. But the problem is I just had to stay away from the radioactive stuff, right? I think that was the one rule I had at home.
Yeah, definitely stay away from.
We could have had Peter Parker.
Oh, yeah. You're right. I missed that opportunity. Yeah, that's right. That's right. But no, I don't know. For some reason, when my folks were doing that stuff, I was doing web programming, music. I don't know. But I guess the sort of the things that I saw in my folks, which was, on my dad, this sort of creative hypothesis generation thing, and then in my mom, this ability just to, burn the midnight oil, to test these hypotheses. Maybe in some sense, I don't know if I'm kind of the fusion of those two things, but I was definitely inspired by that growing up. And so I try to do a little bit of both. But in some sense, each one of those is a difficult thing in and of itself, right? But I don't know. I mean, was I a difficult kid? I don't know what I was. What's that?
Was Peter naughty? What was Peter doing that displeased you?
You were going around the world. You said, he decided he got something. You were going to Greece and then from USC, and then he said, "Gee, you want to go to Egypt during the Christmas break or something?" Went over and sat on the Nile.
Yeah, but they told me, listen, I have to use a little bit of iodine and I got to grow a beard. That's, I think, what they told me.
And then, you went to England, he did a lot, went to Germany, decided to set up in Germany, was at Harvard and he had to leave Harvard because they wouldn't let him study under this one guy that he wanted to study under. So he went to Germany to do that. So there he was up on the mountain, and where was that?
In the Schwarzwald. Wait, so when I told you guys I was leaving Harvard, do you remember what you said?
Yeah, no, we were unhappy. He said, well, you're not going to stay at Harvard just so you can banter around. I'm at Harvard. But, why not? This was like a really good thing. It was at Harvard.
It's true.
Off to Germany, but he learned German so well that when I was dealing with Roche in Germany, they couldn't believe that he was not born there because he had absolutely.
No, but the thing is, I learned all my German from Nietzsche, so I had this 18th century vocabulary. Couldn't, 19th century.
Yeah, so that's what we were doing, stuff like
Shakespeare in German.
Yeah. I remember, when I got to Greece, I studied classics in college, and I tried asking the taxi driver in ancient Greek, whether he could sort of bring me to this joint, and he just looked at me a little bit crazy. So I guess the dialect's changed a little bit since then. How are we doing on time, Stephen?
You're good. We buffer a little bit. We're gonna.
Oh, let's see. Any last questions?
Kill this annoying beep.
Oh yeah.
Well, now we want to reverse that. I'd love to hear, Peter, what was it like with your parents, with their work schedules? What ticked you off?
Yeah,
or what made you proud? Also, we just don't want to have it one-sided.
I mean, that's an interesting thing. So yeah, definitely. My mom sometimes being gone, doing work a lot. Maybe that wasn't great growing up. Sometimes it's nice to, But on the other hand, incredibly proud of her. Well, I'll put it this way: when occasionally at school, like these little science fairs would come up, and I had a little bit of a home court advantage. And I think we did a couple science fairs when I was in middle school with like a gene expression or something. And
we used the PCR to compare human and mouse.
Oh yeah, human and mouse DNA. And so it's this nice little, I don't know, junior high project, but it felt a little bit like cheating, right? But anyway, I was I was a little bit proud of that.
But he did major in philosophy instead of in science, right?
Yeah, I mean, I tried the pre-med thing, and it just didn't work. But and then the funny thing is, so I had this really bizarre trajectory from classics and philosophy to computer science and Google. And I still don't know how I got there, by the way. It was just some kind of backdoor.
I know what we did. We were trying to get a statistician at MD Anderson for a big project we were doing with Pharma, and he wouldn't talk to anybody. And then finally he said, "Are you related to the Peter who developed this R thing?" I don't know what it was.
Oh, yeah. So there's this thing called Roxygen, and there's this R language, and I kind of did this thing. But what was I going to say?
Yeah, so we got him as a collaborator, and I think you used that at Google too.
Oh, yeah. But then this really strange thing happened. I was telling Bernd this, actually. So I was giving a talk in Oxford a couple months ago. And there's this Institute for AI and Computer Science. And so at the time I thought, and it's all staffed by these philosophers and these cognitive scientists. So I had no idea that there was a connection between philosophy and computer science. So I go to Oxford, and it turns out now there's all these professors, and somehow philosophy and AI is this thing now, which is a little bit weird. And so I guess I'm starting this fellowship.
Didn't you start that AI and philosophy thing over at the Gemini meetups?
Yeah, I mean, to extent. So we, by the way, if you guys happen to be in the South Bay, we do this Gemini meetup every 2 weeks. It's just geminimeetup.ai. We'd love to have you. But we did this little philosophy podcast last week on Friday, and so 4 people came, and I don't know, man, we must have been talking for about 4 hours, right? Somehow we outdid Joe Rogan, I thought, used to be the canonical 3 hours. But anyway, it turns out, I don't know why there's this philosophy AI connection. For this Oxford thing, I just wanted to get aletheia.ai. So aletheia happens to be the name of my daughter, and in ancient Greek it means truth. And aletheia.ai was taken, and I just went through the gamut. I tried to pick all of the esoteric ancient Greek philosophy words I could think of, .ai. They're all taken, man. So I don't know if somebody's just going through like the ancient Greek, but it just seems to be this. There's some burgeoning connection between the two, which is interesting. So it could be that the philosophy thing was ahead of its time, but anyway, at the time, you guys were trying to figure out what the hell I was doing, right?
What were you going to do as a philosopher? But it is based. We did met a couple of doctors and that did major in philosophy because it is,
Well, I wonder with the large language models if the primary. I could imagine that philosophy is one of the primary training sets, and maybe you would know a little bit more about that in terms of like. I imagine there's building blocks of, okay, let's take this as the foundation of our foundation models, and then build upon that.
Well, especially the so-called, I use quotes, but this quote-unquote reasoning, that LLMs do is essentially, like you said, it's trained on these philosophical foundational texts, and it engages in some reasoning-like or some sort of logic-like language patterns. And you're absolutely right, that's straight from philosophy. But, even the funny thing is, and so we talked about, the division of labor going forward between humans and LLMs. And it could be that in the future, a lot of the stuff that we have to do deals with facility and language and in essentially communicating with these machines that speak English to either think through things or whatever. So it's possible that maybe in the future, I wonder if training in logic, training in language, I wonder if that'll come in handy. Could be.
And before we go, I'd love to hear from your folks. How are you starting in biology, and where we are now? I'd love to end these on what is that future that you see as possible with the evolution of technology and our knowledge and our research. What do you see, especially based on your fields, as we move into the future?
Just think quick analysis. I'm for patients. I'm mostly looking into what I know about cancer patients. It takes so long to get the information you need, and there's all these hopes and dreams while you're going through treatments, and how am I doing and everything. And the expense of running these full sequences is way too high to do often. But I think with LOMs, we can possibly get things done in time so that patients can use it instead of just. They're right now still just shrugging their shoulders and saying, we don't really know what your future is, but as a cancer patient. And with cancer, it's really important that you're able to know in advance because the treatment's so much better. So as far as just the small sliver of things that we're doing as far as treatment, I can see that being a huge help. And, I'm sure and there's other aspects too that the analysis being done correctly and quickly of huge data sets is critical.
What do you think, Paul?
Yeah, that's about. Kathy's the expert on that part. I'm a little bit, old school, so sorry for me. I haven't been doing that for a while now. She's been doing that company, all this gene expression stuff in blood, but yeah, basically.
But they're not there yet, and and we did it years ago. So that's what's aggravating me. I'm going to
no, there's a
Stanford.
little bit of
We're going to
latency.
doctors at
That's right.
Stanford, and I said, well, is there any? Aren't they doing this at Stanford? It's out there, and it's critical. It's gene expression. It's what you need to analyze the cancer patients.
Like some people are just ahead of their time.
No, and that's when I wrote to
Well,
chat. You know, and chat said,
No, there's a lot of scientific studies, discoveries where this guy makes a discovery and then you find out that somebody else has done it 20 years before. But
well, anyway, the other
Or-
AI was able to tell me the precise labs at Stanford that I could talk to that would probably be
ChatGPT?
interested in. Probably be
No, I think that was the
interested in-
latest version of Gemini.
Yeah, it must be.
So I'll have to find out. But anyway, they were able to pinpoint the labs, so I have to talk to them because we're up here now. We're in Southern California, but we had this big fire and our house disappeared. So now we're in Palo Alto. So we're practically walking distance from Stanford. I can talk to some of the best guys that might be interested in doing a little work.
All right,
We had
Stephen,
we had a
by the way,
very
yeah.
interesting thing. Our later panels yesterday were on stem cells and peptides, and trying to create some consistency in the protocols, because with this great potential, there's a lot of people that are practicing that aren't necessarily trustworthy. So how do you tell the difference between the two? But hopefully we'll be able to determine that, especially amongst the people who are at the forefront of the industries that we know.
Wait, but you're saying, how do you know whether or not your doctor ChatGPT their way through med school, or what do you mean? Or,
Or just trying to make a buck, who knows what they're packaging.
But there's also research that doesn't make sense too. People don't really analyze their data correctly. They analyze it with one eye open instead of both eyes closed, and just looking at the answers when they do the analysis, and they'll throw out points and this and that. So you think, LLMs would be able to do it correctly and make sure that they give you the bad news if your research isn't really going well, instead of pretending like it.
but that's what you have to turn down the sycophancy, though, right? Because otherwise they'll just say, hey, listen, your data is great, bro. Publish.
Yeah, so there are people that publish things that aren't reproducible. So I think getting something like this, especially with big data, is going to be critical. It's happening.
well, especially in clinical studies, there's a lot of contradictory data, and sometimes, we see, estrogen causes breast cancer. There's a big deal 20 years ago. Then later you find, it doesn't really, and so you don't know what to make of it. So
Well,
yeah,
they
there's
do
a lot of
meta-analyses, but in a nanosecond, the LLM could do that. Right?
untrustworthy studies out there.
But you're saying, especially when you're deep in the clinical study, you've been in there for decades, millions of dollars, and the temptation is maybe to, massage the data a little bit, right?
Yeah, I've seen that happen. But, the data's still there. The raw data is still there, so you need some outside analysis of that. But just, people have been looking at just, if you go to a doctor right now, you get 1 or 2 or 3 or 4 genes. If you, get an analysis, especially for some kind of cancer, you don't get the whole genome. You don't, without, buying it yourself. And then what do you do with it yourself? Nobody on the doctor's side is going to analyze it for you. So all this stuff has to happen with LLMs, and it'll be great. I mean, it's going to make a huge difference in treating people quickly instead of too late.
Well, this has been great. I really appreciate you bringing the family. I love the way this all came together from our initial
thanks.
conversations. I was like, yeah, you're like, my parents did this. I was like, bring your parents.
No, Stephen, thanks so much. I really appreciate it.
Yeah, thank you very much. Everybody give it up, and come join us every 2 weeks. Peter hosts on Fridays at 5 o'clock Gemini meetup, and it's chock full of philosophy and cutting edge stuff. We see some of the best new techniques and show and tell there. It's amazing. So thank you, Peter, and thank you, Peter's folks. Thank you, Kathy, and thank you, Peter.
Stephen, thanks so much.
Sometimes we bring chili, so extra food.
And then we have, let's bring up, Prasoon Mishra. Come on up, and we'll plug you in and get things going. And please hang out. We've got the speaker lounge, so everybody knows. Anybody that has a blue wristband or a gold wristband, you can make your way to the corner on the left here, and we've got a speaker's lounge back there. You can talk to folks a little bit more, peas and whispers, or back in the front room is a more boisterous space, and we have lots of folks exhibiting there. Okay, Prasun Mishra here, everybody, and we'll get his slides up on the screen.
So usually function F12 does it, right?
We could put the machine there and give you a clicker or plug it in over there.
Let's see if that.
We have to coordinate the, we have to plug it in. Let's see if we can put it over there. Try to do Eric, give us a shout. What's up? All right, give us just a couple minutes here.
It's not detecting that.
We want to put the dongle in his machine. Yeah, it's in that machine, right? This machine. Okay, disaster narrowly averted. I love those. Okay, let's transition here. Everybody grab your seats. Take your seats, please. We have our next presentation up.
Welcome, everyone. Yeah, sorry for the technical difficulties. And my name is Prasad Mishra, and I lead a nonprofit called American Association for Precision Medicine. And we have a growing ecosystem. I wear a couple of hats: operator as well as an investor. Today's talk will be focused on how we are bringing together the whole life science discovery ecosystem and how it's being transformed by AI. And this is a outline. I'll walk you through this. But first, since there's a tech crowd, so we have moved from AI embracing almost all covers of magazines to designing a covers of magazines to being published by magazines impersonating as writers. And I wanted to bring this one is garbage in, garbage out philosophy. Whatever you put in your data, the output remains the same. To the major players that are leading the AI healthcare revolution today. So what is AI? You all know that AI basically is we have moved from AI, ML, natural networks, deep learning towards generative AI, to AI agents, agentic systems, and agentic ecosystems now, that are leading several of operations. And it depends upon it's a tech ecosystem. So what island you are on? The majority of LLMs are on the treasure island, but I think the data scientists are in the first island. Healthcare overall is a poster child for AI because as you can see, 22% all the healthcare organizations are utilizing AI. And this week at JPM Week, we have heard big announcements where both ChatGPT and Anthropic has launched their HIPAA secured versions actually. So if you search healthcare information, it will not populate the general AI algorithm actually, which is a big leap ahead. And healthcare AI, where all the money is going into startups. So if you're a startup founder, I think you should have a big shot at attracting these. Funding. And overall, the ecosystem is huge, actually, the healthcare ecosystem. The applications of AI is in drug discovery, in medical solutions, imaging, robotic surgery, personalized treatment. LLMs themselves have applications in digital health, diagnostics of diseases, patient experiences, clinical efficacy. And overall, I will start by, how we are utilizing first in healthcare, and EHRs have been biggest enablers. This is when first time you go and see your physician, and there has been a lot of M&A activity in this field, and sheer billions of dollars on these deals will, affirm the importance of this whole ecosystem. And you see now there are companies that are, over $1 billion valuation in this ecosystem that has built. Again, AI is now can identify, diseases at par with physicians. Actually, the radiology, melanoma detection. We can now utilize AI in, diagnosing cancer, infectious diseases, personalized medicine, life science disorders, neurological disorders. In medicine, drug discovery had been a biggest problem, and we took a stab at it, trying to see how we can reduce the cost to develop drugs by half and time to develop drug by half. And I'm one of the co-founders of Agility Pharmaceuticals, where we brought the timeline. So if you have a drug that during COVID we did, we bring a drug from discovery to FDA filing in 9 months actually. And if it's a new molecule, we could do it about 2.5 years, actually 2.5 to 3 years to bring to FDA filing, which is a major advancement actually in this field. So again, in AI-powered drug discovery has many different use cases within the ecosystem. Also, high throughput screening that enables drug discovery. So what I believe is that the future belongs to the automated labs. These are robotic-driven labs, and human intelligence can be predicting the data that's coming out. And Lilly, just this week, Lilly and NVIDIA signed a 5-year deal worth $1 billion. They're pumping, and the automated lab will be here, based in the Bay Area, which is a blessing for us. Again, robotics has implications in surgeries. Robotic-assisted, surgeries are now common in hospital. A lot of my friends are doing it routinely, and they're very, very happy with what's the results of it actually. So, moving ahead in clinical trials, so this is an area which is highly regulated and needs a lot of AI transformation. And there are different ways we are doing. We are from trial design to startup to trial conduct to study closeout. We're doing different innovations in AI, and post-COVID, virtual clinical trials are common now. So you can be a patient, and we can receive a kit, and you can do all the tests needed, and then only go to hospital for the care visits actually, where you have a test being done or blood draws and all. So this is a routine. So if you are a patient, you can utilize all apps to enroll yourself, to monitor yourself, wearables to monitor symptoms and record them, use the app to get a car to the hospital. So everything is coming together, and a hybrid system is a way to go, where hospitals and decentralized systems are working together. So in digital health, medical devices, so I mentioned wearables. This is a great field. This is we have been seeing a lot of advancements in this field actually. And then, in fact, the current decade belongs to finding medical solutions. And AI and robotics will define new health, and the market is poised to reach about 148 billion by 2029. That's the end of this decade actually. So the last couple of areas that I will put on is a highlight is supply chain. Supply chain is a delivery where you get your drugs to the pharmacy, to the patient. And it has been a linear supply chain model, but now the model has been evolved to be a circular, where you have smart factories, smart warehouses, smart trucks, sensors, and then eventually goal is that a drone delivery. So you order, your medication will be delivered right in your house actually, or in a common area where you can go and pick it up. And this is not a dream. This is a reality. That is happening in several countries, and I think we'll take an advantage of this soon. So last is sales and marketing, and the patients. How do we? So this is a big area, to disrupt. So the way drugs are sold today and distributed today is opaque, inefficient, and costly. And technology is making drug delivery faster. So what we are seeing is that the traditional wholesale model is now being replaced by blockchain logistics, and blockchain logistic to guarantee the product integrity. And then online pharmacy has taken. So there are several online pharmacies. There are now specialized pharmacies that you can directly order and get your. So we are moving from what used to be intuition-based to evidence-based to precision-based, healthcare, from symptom-based to cohort-based to algorithm-based, and now patients are consumers actually. So we have seen from government initiatives to a lot of ongoing other initiatives actually who they're making patients as consumers and the center of. So that's where the field is moving, and we are moving from the transactional to co-innovation model where the community efforts are honored actually, and patient input is taken into account to refine the product actually. So where are we going? We are moving from basically a future of precision medicine is that you go to the hospital, you have your multi-omics done, you have your imaging done that goes through a personal molecular classifier, and then the personal molecular classifier delivers the promise of precision medicine where digital health, that's right drug to right patient at the right time actually. So the field has moved beyond just one drug diagnostic combination. We have moved to, so the precision public health is a very hot topic right now, where your health is, affected by the areas you live in actually. Are you living in a polluted area, food deserts, disaster areas, you have a racial disparity or vector-borne diseases? These are all affect, so this is collectively called exposome, and how your exposome affects your health, that is a big driver and can be indicator of a precision medicine. So we are, so the ultimate goal is to create a digital twin of ourselves actually, and then could be the full twin, could be if it is a lung specific, like you have a organ specific digital twin, heart specific digital twin, and then this is the way we can keep track of our activities while we live our lives. So in the last few minutes, I will highlight the organization that is behind accelerating precision medicine and transforming patient health. It's a nonprofit, AAPM. We have an innovation center. We have helped a lot of companies from idea to products. Actually, we also have an accelerator where we have helped a lot of companies accelerate, raise $1 to $3 million to go to the growth stage. Our ecosystem was underlying, a push for creation of a WISE, World Investors Entrepreneur Society. That's an investment collective now supporting growth stage companies. And during COVID time, we did a lot of work. Actually, we are credited to having the first global task force that was created in US. This was 300 plus strong individuals, and they were all executives in the company. So they had access to hundreds of employees. So our collective reach went beyond in thousands, and we organized ourselves in different departments, and we tackled the different ways how do we inhibit the spread of COVID. Actually, from detection to diagnosis to treatment, we spun out Precision Biopharma. That was a company bringing an oral COVID drug to the patients. Actually, to how do we assist patients to physician and patient interaction and mental health. We created a mental task force that helped to cope with mental health problems. We created cancer and COVID task force. As soon as the COVID hit, the cancer patients were the most affected. So we created a virtual system where if you're a cancer patient, you can see so you can just chat with the physicians. And we brought in world's top physicians who basically helped on demand actually. And then when India was hit with the second wave of COVID, we created a coalition, and we distributed a lot of PPEs, instruments, BiPAP machines, ventilators in India. We collaborated with Prostate Cancer Research Foundation based out of Mount Sinai, and Bharat Foj was a distributor. They helped manage the logistics, and Anupam Kher is the Bollywood and Hollywood star. He had an organization which he utilized to distribute that, to bring this to patients. So we have done a lot, but given the limited time, I'll just summarize by saying, where are we going? Basically, we have already have AI is already assisting with monotonous tasks. Actually, we have chat bots, right? That is making our life much easier right now, and of physicians as well. And virtual healthcare assistants, this is another wave. Actually, we see in Ambient Scribe and other companies, there are big deals that are being done. It's making lives of physicians much more easier and reducing burnouts and other things that has been a chronic issue in the field. And overall, together by smart treatment design to mining medical records, I think we are pushing the field together, where a physician and patient can spend more time, and rest all can be taken care by technology. So I'll leave you with this. So AI robotics coupled with analytics and smart imagination will transform medicine and healthcare, and future is bright. And I like this quote, and I'll finally leave this with you. Nothing is impossible. The word itself says, I am possible. So let's collectively as a team push forward, because the future will not be built by individual or corporations. Future will be built by we all working as a communities, as an advocates, as patients, as payers, as providers. So thank you all, and look forward to any questions right on time.
Okay, hold, keep the mic. And any questions, raise your hand. That was chock full of information and great history and work that you're doing. Raise your hand if you have a question right there. I'll get another mic runner as well.
Hi, Dr. Bisher. Thank you. Pleasure to see you speak again. Very nice. Can you say a few words about where we are with alarm fatigue and information overload in healthcare practice? What organizations and providers are doing to try to make sense out of being inundated, and then trying to apply it to what they do?
Yeah, so as I understand, healthcare information overload, right? Actually, that's the question.
Really?
Yeah, so yeah, I think this has been a big, all my physician friends, they say that their life is, mostly, their day mostly goes on entering, data actually. So this is where I think I'm the one I mentioned about ambient scribing, right? This is one thing that a physician can wear and then can listen, and then the AI can do that work for a physician. Actually, that's what I'm excited. And there are other utilization of AI in nursing as well. Actually, and then overall in the whole infrastructure of the hospital care system, actually. So I think we are making headways, but we are still very early stage, and hopefully this revolution will will manifest in the next couple of years, actually.
Okay, raise your hand if we have another question. Otherwise, we'll make up on some time, but I really appreciate that. So you can find Prasoon's information there. QR code, grab it before it's a fleeting thing, these screens. So Prasoon, thank you so much for joining us. It's always a pleasure to have you here at HealthTech Week. So thank you for coming and joining us. And everybody can catch us on the live stream. Big hand, Prasoon. Okay, now we're going to switch back to the slides. I know we have a little unplugging thing to do. Those will come up, and Lisa and Bill are going to start making their way to the stage.
Okay, great. Happy New Year, everybody. Happy New Year 2026. I know we are maybe half an hour away from lunch, but we're really excited to be here with you today. It's going to be a fireside chat with myself, with the amazing Bill Tai, and you. So, off of the phones, off of the tablets, everybody in the speaker's corner, we invite you to join us. My name is Lisa Lamy. I am the managing partner of Maroon Invest Global. I come from a multi-generational family focused on preventative medicine, genetics, engineering, regenerative medicine, all focused around prevention of chronic health conditions, what we now call healthy aging and healthy longevity. The firm is global, based out of the US. We're in 16 countries globally with hubs in Saudi Arabia, UAE, Singapore, and many other countries. And I'm really happy to be here to have this fireside chat. We have 3 areas of focus. We have a research institute as well, nonprofit, where we're focused on driving real critical innovation across the spectrum, eliminating the innovation silos, and actually backing companies that will become commercial at scale and help mass population. So we're focused on that. We have 4 areas specifically that we're focused on: neurological and brain health, cardiovascular and blood health, respiratory health. The previous speaker was talking about climate and exosomes. That is a big focus of ours. And then autoimmune disorders and inflammation. So that's the Institute. And we welcome you to listen to Ritu later on as she'll be speaking. She heads up the Institute. The other area is our investment platform, where we do everything from VC to direct investing. So that's enough about me. It is my absolute pleasure, and I'm so excited to introduce Bill Tai. Bill Tai has been funding startups as a venture capitalist since 1991, and he has 23 of his startups that have become listed companies. He is a personal angel backer of 3 of the top 10 CNBC top 50 disruptors of 2022, which include Lineage Logistics, Canva, we all know Canva, Dapper Labs, and Zoom. Okay, this is the person that's going to be joining us in the next couple of minutes. So get ready for this. Companies he has been involved with from the start have surpassed not 1 million, not 1 billion, 1 trillion in aggregate market value since 2021. That's just 5 years ago, including the 8th most valuable company in the world as of November 2024. Originally trained as a chip designer, he joined LSI Logistics, a Silicon Valley startup formed by the CEO of Fairchild Semiconductor, after receiving a BS in electrical engineering from University of Illinois. Then he got an MBA from this place called Harvard and has done a lot of things. He also established a semiconductor practice for Alex Brown and Sons, positioning the IPOs for Atmel, Cirrus Logic, Dallas Semiconductor, Zilog. And he's still going. He's a co-founder and chairman of Treasure Data, acquired by ARM SoftBank. He's a chairman and amongst the first investors in Bitfury, Color Health, Dapper Labs, MetaGood, Power Ledger, Safety Culture, Wish.com, Diet.net, Gigaverse, and more. He's the founding board chairman of Hut 8 Mining, an energy infrastructure company with subsidiaries in high-rise AI, NVIDIA-based GPU data centers, Bitcoin, and lots more. Very interestingly enough, he's also the founding chairman of ACTI Global, which is a community of athlete conservationists and innovators. So we're going to talk about sports performance and the intersection. And most recently, he serves on the board of advisors of the dean of Harvard Business School and I'm sure it gives him some insights. So, oh my gosh, it's so exciting. And so in recent years, he has used his genius and tech expertise in AI and the like to start to look at the intersection of the 2 undoubtedly biggest game changers of certainly my lifetime and possibly of this century, which is, of course, not only AI, but precision medicine, preventative health, and longevity science. And so with that, without further ado, please give a very warm welcome to Bill Tai. All right. Okay. You sit there, yep. Okay.
I think Bill needs a microphone.
He needs a
Okay,
mic.
Bill, how are you? Good to see you. Can you guys maybe sit together in the middle?
Yeah.
Yeah.
Go.
Is that good?
Sit right there.
Right here?
It's fine.
Great.
Yeah, perfect.
Okay.
We need a tight two-shot.
We need a tie. Okay. Well, we'll get close.
Perfect.
That's okay. We'll get close. Okay. So enough of talking from me. Bill, listen. Oh my gosh, what an honor to be with you here today. You've been such a innovator, such a trailblazer. Overused word, but man, does it fit you. Can you just give us a little insight into what has led you to build these companies, a little bit about your story, and how has it all culminated in you even doing more than what you've done? You've now been the founder of 3 amazing breakthrough companies at the intersection of AI and health. Just give us some of your insights.
Well, I guess you just have to live long enough and be in the right place at the right time. And I guess on that note, there's this phrase that Woody Allen uses, which is 80% of life is just showing up. And then I always add to that you want to show up at the right place at the right time. And somehow I ended up in the 80s. So this is quite a long time ago. Silicon Valley was still kind of agricultural. And I came out here in 83, lived in the back of a cherry orchard, and joined a startup with one of my relatives, Jensen Wang. So Jensen was in engineering and I was in technical marketing at this startup called LSI Logic that was created by the then CEO of Fairchild Semiconductor. And Apple and Intel were startups. Don Valentine was on our board, and he started Sequoia. If you don't, some of you guys probably know Sequoia Capital, but Don was a one-man band kind of at the time. And I eventually, Jensen left to start NVIDIA. I left, and I have badge number 1 at Taiwan Semiconductor. We're all Taiwanese by heritage, but that led, eventually I went into venture capital 35 years ago. Don he's kind of a harsh guy, but I had known him from LSI Logic. So when I got into venture, I started to kind of tag along with him, and I learned a lot. Obviously, if you don't know Don Valentine, like Sequoia is a legend, of course, but Don by himself as a backer, if you think about the companies he backed, and many of these are so old, maybe you don't know them, but he backed LSI Logic, Electronic Arts, Cisco Systems, Network Appliance, Oracle, Apple. And so, just in 6 fingers.
Was it just you being in the right place at the right time, or come on, there was more to it than that?
Well, a lot of lessons, so from him, I derived, I did have a dinner with him once where I asked him, what do I have to do to be good at this? And he's a very terse guy, but he basically said, look, it's very simple. You have to, get the market right. And in that era, companies were asset heavy, so this phrase doesn't really apply anymore, but you get the market right, you swap the people in and out until it works, and don't overpay. And if you do those 3 things, you'll make money every time. But if you get the market wrong, you can have the best team in the world and infinite capital, and I guarantee you will lose money every time. So over years in venture, I started funding chip companies and then data communication stuff in the mid-90s. I started an ISP in 94 and ended up with a company with data centers in 10 countries, and Goldman Morgan Salma took that public. But along the way, the early lessons with Don definitely resonated, which is, get a big market undergoing structural change, and you have to pick the right people. And these days, the assets are the people, so you don't really just, swap people in and out anymore. But that's kind of the basic thing. But that, chips, boxes, networks, and then I took some time off, came back in when Web 2.0 started doing mobile app stuff, and then data science, AI data centers. I'm chairman of the board of a public company. We've got, it's about $6 billion, but we have data centers running GPUs around the country. But that led also to health. About 10 years ago, I started experimenting in the health intersection of health and AI now.
And so there are three amazing companies, well, more than three, a lot, but let's focus on just three. So can you give us some insights into what was the genesis? What was the thinking? What was the problem that you were trying to address, which then culminated in Color.com, in Algin Bio, and then also in Dyad?
Yeah, so these span some different, I guess, generations of technology, happen really fast these days. So I think I seeded Color Genomics was the original name around 2013. And over time, and all of you have worked in companies and you know that there's always a few people that make everything happen, and so I've learned over time to just build this network of entrepreneurs, and certain people I'll basically pick out, and I just know that at the right time I will back them. It happened to be that there was a person at this time, he was at the time, he had started a company, sold it to Google, started a company, sold it to Twitter, and then at Twitter he was VP of Engineering, Growth, Revenue, and Engagement, and running their data centers. And he basically fixed Twitter when Twitter had the fail whale all the time, was going down. And I told this friend of mine, his name's Othman Laraki, I was like, Othman, if you ever start a company, I don't care what it is, let me know, I'll write a check.
I'm there.
And so one day he does call me and he says, hey, Bill, let's get together. So I meet up with Othman and he says, I'm going into genomics. I was like, you don't know anything about genomics. And he said, yeah, but I do know, you know what Moore's law is with the silicon thing, power doubles every year? Genomics is like 10x a year. He said, there's gonna be breakthroughs in this space. And I said, but what are you gonna do? And he said, well, I have to learn how to use a sequencer. And so I have to buy this machine from Illumina. I was like, well, who's that? And he said, and the machine is like $750,000.
I love the due diligence process that you went through on this.
Yes. So I split the machine with him and his two founders, and then that became Color Genomics. So it started off in BRCA breast.
And what does Color Genomics do?
Today, they are arguably the world leader in AI-assisted cancer diagnostics and therapy. And it does focus on prevention. That was their original roots. When the company got started, they wanted to be a company that could identify propensity for breast cancer by identifying the BRCA gene issues that would tell you. And so they worked out a program with Apple and Salesforce and all the major companies in the Valley where instead of them being on the hook or their health insurers being on the hook to pay for all of that stuff that's very expensive when you are a cancer patient, they could identify your propensity ahead of time and gave you like free tests. The company would pay for the tests ahead of time because it saved them a lot of downtime. And
saves them a lot of money.
A lot of money, yes.
Right.
And the insurer saves them a ton of money. So healthcare insurance companies, they worked with them and the big companies so that the insurers would pay a certain amount every year so people could be preventative. And then COVID hit. And then they became, you guys probably all remember taking maybe a United Airlines flight and having to drive into a parking lot and take a test. They were the United Airlines testing partner. So that COVID window generated like $400 million of revenue for them in a couple of years. And then they plowed that into the cancer thing that they do now, which is more broad spectrum.
So what I love about Color Genomics is it's focused on predictive, preventative health, which is so important. We hear about curing cancer. Why don't we just prevent cancer? To start. That is really the crux of healthy longevity. By the way, it's not the renaming of biopharma. It's not the lifestyle. It's actually let's have the predictive science, which is what your company is truly a leader in, to predict the potential high-risk people for cancer. And another thing that it has really had the foresight of, and I really want to make sure that we touch on this, is the intersection of the payers, insurance companies, and investment into healthy aging. Right now, we're seeing a lot of capital potentially going in from venture capital funds. We're seeing capital going from angel investors, from various celebrities. But who is really bearing the cost of a aging population? Literally, obviously it's all of us, but it's the insurance companies. So to be partnering with insurance companies in a very creative, proactive way, who are saying, you know what, I want to bring the premiums down. Let's bring this together. It's fascinating, and I'm so excited about that company. Another company I want to touch on is Dyad. So beyond the science of predictive protocols and advancing in these areas, there's a lot that AI can be doing to make life easier for a doctor, for a GP, so that they can spend more time doing what they went to med school for, which is to prevent diseases and to cure people rather than filling out a lot of paperwork. Maybe can you just touch on that?
Yeah, this is another story of identifying a person. Okay, so I had started a machine learning company in 2011 called Treasure Data that got acquired by SoftBank. And I don't know how many of you have ever used the consumer site wish.com. If it's kind of faded away. There were issues much after it went public. But if you think about a wish.com, it was a company that basically was a portal for all the products that were made in China. And so how does the website know if you come to wish.com, whether should have put up motorcycles or lingerie or what? So you would have
That's your wish.
Yes, you would log in through Facebook, and then we would use the machine learning to crawl up and down your profile, go into your friends. This is before all the data privacy rules. And we would know who you were, what your age was, what your preferences were, and we would populate the page. And then we would just tune. So on the other side of the Atlantic was a company doing the same thing. We were steering purchases. They were steering votes. And that was Cambridge Analytica. So the CTO of Cambridge Analytica is a genius. He's very, very good at this kind of just data science, AI, and he comes from a family of doctors. And when Cambridge Analytica hit the wall for a bunch of reasons, he was inserted briefly as CEO to kind of shut it all down. And I pulled him and the team out of there and warehoused them. And I said, Alex, you are so good, but we need to do something better for this world. And so we pivoted to healthcare. And obviously healthcare, everybody here in the room knows, it's 19% of GDP. There's 60% of all personal bankruptcies in America every year are due to healthcare costs. And there's 100 million Americans out of the 300 something that have medical debt that they're slow on paying, So, and you look at the payments from CMS.gov and the state of the liabilities that are growing fast.
The system is definitely broken.
To the point where people are murdering the CEOs of insurers, right? United Healthcare turns down, they reject 32% of all claims. So we decided that we wanted to attack that problem. There's so many problems in this. So we started off with a product called, it still uses the name Better Letter, which was a software agent that plugged into the back end of all the healthcare companies. And it's only very standard back ends. And it would basically tie to insurance coding databases, and it would autocorrect basically all the codes. And then that's evolved now into a semantic AI company that basically, if you're a doctor, you see a patient, you write it up, it's digitized in any number of ways, it gets fed into the system, and then you get presented with semantic AI, visual representations of all the things that could be related to what you saw. And then it also ties them to the insurance codes so that you know that if you actually, as a doctor, do use them, you're going to get paid and not have it fall into this netherworld or get put on the patient so that they can declare bankruptcy later. So the solution's a hit. It's growing like 12 to 15% a month and has every month for the last year and a half. But it's called Dyad.net.
And so the adoption rate has been...
It's going. Yeah, it's growing. We don't have a sale. We don't really have a sales team, but it's growing 15% a month. Word of mouth by practitioners.
And so as we look at AI, precision medicine, predictive healthcare, and the immense opportunity across the space, what keeps you up at night with excitement? I'm sure there's a lot of things that keep you up at night pondering, but what keeps you up at night with excitement in terms of how can we, looking forward with this immense, vast resources at our fingertips, really leverage it for better health outcomes? Anyway, over to you.
Well, so it's quite obvious that everybody here is looking at things that are at the intersection of AI and health. And I came at it a little orthogonally from the outside, from a compute background. And you hear Jensen talk about compute all the time, right? So if you look at the power that is afforded to everybody now, like Moore's Law, like years ago, when I started in tech, we used to have mainframes and mini computers. The PC didn't really exist at the time, and you didn't have compute power in your home, let alone these smartphones that are, more powerful than any computer you had 20 years ago. So with the advent of GPUs and matrix math, and the computation power is growing at a rate faster than Moore's Law allowed it to, which unlocks so many things that you guys are all hearing about and experiencing already with little things like ChatGPT. But when you have a data-intensive, complex set of stuff that is all of the junk around healthcare, there are innumerable ways to make that whole thing, which is, I said, 19% of our GDP and totally messed up. And you look at, the costs and the demographics in our country, I think when things like Social Security and Medicare, Medicaid, and all that were created, the average lifespan in this country was like 65. So people are now living regularly to 90 and beyond, and those are the years where the healthcare costs are maybe 100 times what they were when you were in your 20s and 30s. So this country is going to go bankrupt unless that gets fixed, and it may go bankrupt anyway because of other stuff. But it's...
Yeah, no, without a doubt, the system is broken. We only put currently, I think, 4% of GDP goes into preventative health, with obviously 96% going into what I would call reactive care, which doesn't make any sense. From an investment standpoint, we know $1 of prevention is worth $1 million of cure. The actual numbers are 14.3 return for investment in preventative health. And then if you look at specific chronic conditions, it's around 20x for autoimmune, about 36x for respiratory. So without a doubt...
Not percentages, 36x.
So without a doubt, the investment return and thesis is a no-brainer. But as in all investments, it's never a clear path. So I'm going to flip the question around and ask it in another way, which is now what gives you pause, what gives you concern? I think the previous speaker touched on a couple of things. The plethora of data. Now we may have too much data. We may have issues with false positives. We may have just exhaustion of data analysis, become data paralysis.
Yeah.
So what are some of the concerns that you see as a seasoned investor? You've had great successes, but you've also earned your stripes through maybe some ones that didn't go so well. What are some of the things that people should be looking out for, whether or not it's going to be an AI bubble around the corner, whether or not it's people getting overly excited about stuff that hasn't been proven yet, and just the latest, witch doctor peddling their goods? What are the things that you're concerned about as an investor now in some of the biggest companies at the intersection of AI and healthcare?
Yeah, so I think, the operating in a landscape where there's old legacy systems that have behaviors tied to them and incentive structures that lock in place resistance
Back to people.
Yeah, and pre-existing systems. So when I started venture, it was kind of like a no-no to ever invest in energy, too capital intensive and too slow, utilities too slow, telephone company, like that kind of stuff was, and healthcare. And so the venture industry typically was split. So most of the I was with IVP for many years, and we had two groups. We had a healthcare group and IT. And they operated kind of separately until final presentations and all that stuff because the dynamics of the industry were so different. And back then it was mostly like drug discovery stuff, biotech more than healthcare, IT. But I learned, the conventional wisdom was you just don't invest in those areas because it's too hard, and it takes too long. And the internet was a little bit like that too. When the internet got going in the early 90s, the telephone companies were all against it because it ran on their lines and they were charging $1.10 a minute for long distance calls, and you could make phone calls for free. So they were like, no, how do we kill this?
Being the first is never easy.
No. And so it took, in that era, it took the Telecom Deregulation Act of 1996 to change the economic structure, deregulate the business, allow people to compete. And I think without that, we wouldn't have the internet as it exists today. It just wouldn't exist because the phone companies would have quashed it, And so I think the healthcare, it's been interesting to see the last, I've only been in the space kind of for 10 years, 10, 12 years, but the rate of acceleration the last 18 months is very promising because I've had, we had a partner company, a big healthcare operator that works with over 1,000 medical clinic practices want to acquire Dyad. We're not going to sell, but they said, we have customers that are, the clinics are asking for a product like yours. And we're not an IT firm. We can't really do this. So how do we bring this to market? Which is just astounding. It'd be like a phone company asking me, can we bring your ISP to our customers? Like, so it feels like there's an inflection point happening in one of the biggest markets around. And in a whole nother field, this other company I've seeded called Algen Bioscience, it's been fascinating to see that too. They struggled for years on a seed. They managed to scrape by, to get profitable with contracts with Pfizer and Novo Nordisk, which are, cost plus contracts. But they just in October, they signed a $555 million deal to be AstraZeneca's AI drug discovery partner. So I think now everyone's leaning in because they see the disruptive potential of the 1,000x compute power and what it could bring that makes things possible that were totally unrealistic to think about before. So I think we're at a good spot.
All right. Well, I'm hearing a couple of things that for me as an investor, coming out of what you're saying, I'm certainly going to be looking at. One is, how quickly is regulation going to catch up? Right? Because everything is going at a laser pace. Two, you talked about legacy systems. And so there's going to be that disconnect as companies try to upgrade, whether, how much are they going to have to really invest to really get to where they want to be, to really fully utilize it. And then we heard about people.
Yeah.
At the end of the day, we're not replacing people. It's really going to be around early adoption, make sure there isn't resistance, and upskilling as well, making sure that the pace of education upskilling is keeping pace, no pun intended, with the technological advances. That at the end of the day, machines aren't going to run machines. So I think those are maybe some of the, and then the last point around what's happening with AstraZeneca, it's fascinating. Big Pharma is not the enemy. They're actually leaning in and starting to identify the opportunities that they have.
And they have the funds to move the needle.
And they have the funds to move the needle. So let's do this together. Okay, I see we have 4 minutes left, and I want to make sure the third collective person of this fireside chat gets involved, which is you, the audience. So, Stephen, however, it's working with mics. I'm sure there's lots of questions.
Raise your
Bill?
hand and we'll come pass the mic.
Hi, I'm Henry. Thank you for the insights. So we're a startup company. Our first customer is also AstraZeneca, and they're about to scale with us. So we're working on the AI and quantum side. So my question is really, you guys at Color and you guys really scaled up genomics, right, and cancer care. And I think I also observed what they're doing with Algin and Choir AI, right, for early detection. How do you see computing and like the new wave of quantum computing, right?
It's exciting, it's yeah. So I did look at, you probably know D-Wave, which is, so this dates me. In 1994, a friend of mine put a bunch of money into D-Wave and became chairman. And because I have a silicon background, he wanted me to help him on it. And I was like, Paul, this is too early. I think this is going to take a while. But obviously, it's starting to hit now. I think the great thing about bubbles, if you want to call it that, or periods of great enthusiasm, because I don't think it's about to pop or anything like that. But because of the cash flow of a company like NVIDIA, which is now doing about $60 billion a quarter at 75% net income margins, 40 billion, like 15 billion a month of cash flow. And it's very, very expensive to implement. So that, I think, has been a breath of incredible life into quantum computing. And the amount of funding that has gone to the 10 or 15 companies that matter there is astronomical compared to what they had access to before. And it is moving the needle in progress. And literally just this last year, I got excited about quantum again. NVIDIA actually has created a program. I was at NVIDIA with a quantum company that I'm going to back. And they were picked as one of three because NVIDIA has this NVQ Link, it's called for, I think it's NVQ Link. But they do see a day, because Jensen was very against quantum for a while. But he's kind of on board now too, maybe because he's got too much money, he's hedging, but they want to have basically accelerators that can be plugged into standard GPU infrastructure. And I don't know how many people in this room know about quantum, but it's like magic. If you think about regular linear computing with CPUs, it's kind of like one line at a time of code. All of you probably took math in high school where you had to multiply matrices. And if you remember that, you'd have these 3x3 matrices, and in one step you could multiply. That's what a GPU does, right? So the matrix math is multi-dimensional computing.
It's in the name.
Yeah, and you can model kind of a neural network or a pattern of neurons with those little matrix weights. And when you get to quantum, it's freaking incredible because if you have like a couple of complex molecules that could touch each other in many different ways, a linear computing would have to do every one of those states at a time. Might take 100 years to do something. A bunch of GPUs might be able to do it in a couple of years. And quantum can do all states at once if you could get to that point. So I think the potential is mind-blowing for modeling for preventative care and drugs and all kinds of things.
Okay, I think if you'll allow us just one last quick question.
One or two, we have one right here.
Two, okay. And sorry, it's hard to see with the lights, but okay.
Hi, this is Ram Kumar. I actually started a company called CareScribe. I'm actually from the electronic design background as well, and left the electronic design background last year. We all talk about scribing, but last year what happened was we still United Healthcare. We went to Yosemite and there was a small mishap, and we went to the doctor there, and they still couldn't verify our insurance because we still have to fill in the forms. A lot of these things happened. And then at the end, they said the X-ray machine doesn't work. We need to go to a different hospital. So long story short, I created a company out of that. And then currently, we are getting customers. I mean, we trained it for multilingual. So we launched it in India. Now we do have revenue. And also,
What's your question?
Question is, in the US, I'm seeing dentist traction, but a lot of these health summit, I don't see hearing about dental. Where do you see the dental space in the US market? Is this a good thing? That
very similar problems, just a lot smaller in size. So I think there are definitely problems to solve there, and I think you can define. But I think as we talked about earlier, the size of the bolus and the demographics is a much bigger problem to solve.
I can probably just add to that. So you're right. We haven't seen a lot happening yet, at scale in terms of dental care from a predictive, preventative standpoint. But there is an enormous opportunity, at least with our institute. We're starting to work with some researchers out of India and also out of Japan because there are...
You have that bacteria that grows enamel now, right, in Japan?
So there are technologies with regards to, testing of saliva. A lot of certain chronic conditions will show up in terms of your mouth care, tongue care, etc. And so, yes, you're right. We haven't seen a lot yet, but watch this space. I think we're going to be seeing more and more integrative preventative care being used in dental practices beyond the cleaning of your teeth and taking care of cavities as an opportunity for GPs to make early diagnosis of certain chronic conditions which are showing up in the dental care. So I think the answer to that is there's a lot of opportunity. So with that, I know we're over time.
Right on.
Again,
on time.
Bang on time. Okay, great. So again, thank you so much, Bill, for
Thank you, Lisa.
sharing the stage with me today. Thank you to an amazing audience. I know that Bill may be around for a little bit to answer some questions. I'm going to be back with you this evening talking about how to drive real returns out of precision medicine and preventative health and healthy longevity. And thank you to Stephen for hosting this wonderful forum. So thank you. Thank you very much,
both.
everybody.
Thank you both, and thank you for the work that you do. Amazing, advancing healthcare, advancing technology. Really appreciate you guys for your work. So one more round of applause and we'll transition to the next presentation. I can grab it from you. Thank you. We'll get Clint situated here. Come on up, Clint, and we'll come on up stage. Oh, okay, come on right away. No, I got it. Oh, let's bring it with you. Bring it with you. 10 minutes. Do you need a dongle? Yeah, I got a dongle for you. Hang on, you're not. Okay, Clint, take it away.
Hi, everyone. Today I'm going to talk about AI in drug safety case review. I'm an applied scientist at Oracle. I've been working in pharmacovigilance for a while. Before that, I have worked in other industries like retail and generative AI. Here's a functional pharmacovigilance system. Pharmacovigilance deals with detecting, assessing, and preventing adverse events associated with drugs. It involves multiple stakeholders, as we see here, and also fragmented data sources, because the people reporting adverse events could be a consumer, they could be doctors, it could even be from social media, and this can also happen at various life cycles of the drug, could be clinical or marketing, post-marketing. Some of the challenges with medical safety case review is particularly the cognitive overload that a reviewer faces. In a bunch of the previous talks, we talked about, people talked about data paralysis, and having a lot of data can actually be really hard to sift through. And safety data in particular is fragmented across narratives, clinical notes, you have concomitant drugs, drugs playing different roles, and like the timeline, the dosages may be off. So it's a bit of a headache for a lot of companies. In fact, case loads are increasing around 30 to 50% a year, and pharma companies handle an average of 700,000 adverse event cases annually. In order to use AI for something critical like safety, there are these three pillars, so as to speak, that you really need to build for. The first one is the domain adapted intelligence. So you not only need agents and LLMs that are tuned to healthcare, but also tuned to PV language, specifically, things like concomitant, suspect, treatment, and all the roles that a drug can play, as well as all medical coding like MEDRA and other information, other nuances as well. And the second pillar is evidence-grounded generation. The biggest problem we have with AI system is hallucination, specifically in safety. They could pick up on what is publicly available, like what people claim a drug is causing, can lead the models to predict that. Rather, what we really need is something that's evidence-based. So you want to be able to trace the output to, okay, what's the evidence that you said this is an adverse event of this drug, or any other evaluation, like is this really serious? Is this case really serious as per the regulatory definition of seriousness? And so evidence grounding is very important. And the third one is explainability and confidence awareness. And here, when you ask LLM to say, hey, how confident are you in the prediction you made, that's called verbalized confidence. And often verbalized confidence is not very trustworthy, or is unclear on what that means. So we will also look at some techniques on how you can use verbalized confidence, or are there other techniques to actually get confidences out of LLMs. So the crux of my talk is about how knowledge graphs are helping build these three pillars that we see before, that I showed before. So the first advantage in using knowledge graphs is they make the safety knowledge explicit. So you now actually can model the probability graphs in such a way that different drugs are grouped accordingly. You bring your domain knowledge in, and you're carefully curating this data on which the LLM then operates on. And the second important thing is encoding domain and regulatory semantics. For example, the regulatory requirements in US might be quite different from what you see in EU, and you can bring specific regulatory knowledge graphs that combine with the bigger graph to kind of let your agents adapt to different domains or different regions. And finally, the explainability and confidence aspect that I spoke about before. Because graphs can be traced, the paths in the graph can be traced, you get a bit more explainability than having a black box LLM model. The first technique that I want to talk about is called graph neural prompting. This is work, I've cited the work below. The central idea here is using a GNN, a graph neural network, as part of your LLM, the foundational model. And so in this way, you can actually fine-tune the foundational model using structure as a key component. And the authors here actually show that this works a lot better compared with prompt design or even like LoRa-based performance-efficient fine-tuning. To note, though, these experiments were performed on FLAN, which is a bit of an older encoder-decoder model, but I do believe these results even scale to present-day LLMs. These kind of LLMs, these kind of hybrid LLMs or hybrid AI models are actually helping us control the hallucination and like explainability of the underlying technology. However, agentic systems are still, so you still don't have like a single model. You still have to build them in layers around an agentic AI system. For example, here we see, this is from our upcoming work in AAAI, but you see an architecture where you can use the previous graph neural prompting as part of a bigger agentic AI architecture to have this conversational interface where you can question the LLM about, hey, I have this case. In this case, do you see any potential drug-related adverse event? And the system now uses these different agents, which are, in this case, signal or causal graphs, which might be depending on your domain. For example, one signal graph could be, say, empirical EGM-based signals that can be modeled as a graph, the disproportionality analysis, or it could be even a Markovian causal graph from which you are getting causal estimate. But because you're able to combine these both, you actually get way more explainability than a traditional symbol LLM agent. And finally, I want to touch about confidence awareness. There is the first way of getting this, there are different levels at which you can get confidence out of agentic AI systems, and some are more expensive. So you reserve the more expensive ideas for something very critical like an adverse event prediction, whereas you could use something less expensive for entity extraction or other forms of subtask in PV itself. So this confidence, this is kind of helpful for if you have a good signal database that you can use. This is kind of helpful to give that confidence from the signals. The second is ensemble-based. This is when you have multiple agents or multiple kinds of prompts, you run them over, and then you aggregate that and use that to get the confidence. And the third thing, because of the architecture I currently presented, you also now have topology in the graph. So the knowledge graph kind of tells you, okay, this drug was connected to this many AEs, how many times? And you can get insights based on the topography of the graph to then derive your confidence signal. So you get these signals from the structure of the graph itself. And finally, and the gold standard is to do probabilistic inference, because signals can be wrong. They could be correlation rather than causation. So you eventually do want to do like probabilistic inference. And now this is going to be the most expensive, because here you have to actually run the inference on that case multiple times. You have to get the full probability distribution, estimate the conditional probabilities, and finally you produce a more calibrated confidence. For example, here's a work that aims to do this using the Bayesian inference framework. In conclusion, we see that AI can reduce reviewer burden without compromising trust. And knowledge graph and ontologies play a key role in traceable evidence-based reasoning. Yeah, quantitative grounding and confidence awareness are really important to really use AI in this field. Any questions?
Oh, Clint, we have time for one question. Okay, sorry about that.
Thank you for the knowledge graph. How does DSPY fit into your knowledge graph? DSPY from Stanford, I think there's a paper on, I don't know if you're aware of it, but instead of prompt engineering, you can do programmatic way of doing things.
Right.
How does that fit into your knowledge graph?
The knowledge graph really gives you the domain knowledge for your particular drug you're developing. For example, you may have a certain amount of knowledge that's only privy to that company, right? So that's where the domain knowledge comes in. So if I don't know exactly the work that you mentioned, but if I understand, that would be a comparison to the Bayesian inference framework that I mentioned. Yes, there are many variants of that, and this is just one such framework which could be used. The framework that I just popped up uses verbalized confidence, verbalized estimates again. I would have to look more into the other one you mentioned.
Big hand for Clint. Thank you for joining us. Great work. Deep work. Okay, next up we have Dr. Daniel Kraft joining us. He's always a crowd pleaser here. Amazing scientist, doctor, been in this for a long time. Right there. Cool. I would just get his slides up. Eric, give us the shout. We've got an amazing audio engineering crew, video engineering crew, live stream crew. Eric Roach, raise your hand back there. Big shout out for the crew. Tyler back in the sound booth. We got Manny up in the video booth doing all this projection. This is amazing projection mapping. Have you guys looked behind you? I think what we're spending here is just worth it just for that, just to see our branding that big on the back wall. Eric, we good? It'll show up there. Yep. Okay, there you go. Dr. Daniel Kraft, everybody.
Hey, everybody.
Give it up.
Great to be at Health Tech Week. It's hard to believe it's 2026. I'm going to take you on a 25, 30-minute rapid dive across the future of health and medicine. There'll be a QR code at the end if you want most of my slides, because I'm going to go pretty quick. So first, a little framing. It's a bit of a challenging time in health and biomedicine, from defunding of the NIH to anti-vaxxers, so lots of tides and currents and winds. But I love this optimistic quote that the pessimist complains about the wind, the optimist expects it to change, but the leader adjusts the sail. And so the good news for all of us in health medicine technology, there's a lot of amazing new sort of winds at our back to help re-advance the future of health medicine across the whole care continuum. And of course, I made those images with AI. We're all using GPT and others to make our videos from text. Of course, like all elements in technology and AI, they're not perfect. I made this little one the other day. We'll see if you can find the AI challenge that wasn't quite accurate. Anyone see the problem there? There you go. Not quite the band. So, we can all do sorts of fun things. The sound is not going to work.
Faster than you think. Let's create it together.
So AI is easy, AV is hard. I flew myself here today.
Not your typical commute, right? Good news, the future of health is looking up. Literally. First airborne house call, no copay for the view. And hey, if anyone needs a quick vitamin D boost, I brought plenty of...
You get the idea. So it's all going to be magic what you can do with AI. And from the medical perspective, and for physicians like me, already all the forms of GPT, Gemini, and beyond already can do a better job than most doctors in passing the medical boards. Many of you don't go to Dr. Google anymore. You go to Dr. GPT or Dr. Gemini to answer your healthcare questions. And as you heard just last week, ChatGPT is launching their health type element, which will make it even easier to share and integrate your medical labs data and make sense of that over time. So really interesting inflection point where a lot of big players from Microsoft, Apple, OpenAI, and beyond are all getting into the health space. And so the challenge is, what does that mean? Will AI be defeating doctors in diagnosis? It was mentioned earlier, it might be soon malpractice not to have had your physician or care team use AI in terms of doing a medical workup or a diagnostic path. So the future is coming a bit faster than we think, sometimes before we're actually ready for it to arrive. And there are still challenges, right? Even with AV, and some things to think about cognitively for all of us. There's a famous quote from Sam Altman that GPT is like an e-bike for your brain, which is great. I have an e-bike, it's fun to ride. But what if your kids never learn how to ride a regular bike or never develop their biking muscles, or a medical student never learns how to develop a differential diagnosis by themselves? What happens to our capabilities? An example of that was published a few months ago about de-skilling. This is your gastroenterology doctors who were used to doing colonoscopies, now aided by AI. But when you took away the AI help, they lost their ability to do their job the old-fashioned way. So we're going to upskill and also potentially de-skill. So we have to think about the future of the workforce education in our minds. But like many of you, I'm an optimist. I don't think about generative AI. I think about generative health, this sort of emerging world of multimodal, agentic, digitally enabled health, where each of us soon or even now could have your own sort of health agent based on your age, your culture, your personality, your health journey goals, your health span envisioning. And those can come to you in almost any form and really democratize who gets care almost anywhere. And we're seeing these examples of these agents. There's folks here from Gemini and beyond building these personal health large language models, which can don't just give you guidance about your step and sleep, but hyper-personalize that, make it contextual. We don't just want artificial intelligence, we want contextual intelligence that know that you're jet lagged or you're up too late at JP Morgan, you may not be ready for your 6 a.m. workout. So big picture, this convergence of winds at our back can hopefully make healthcare a bit more intelligent, more contextual, data-driven, proactive and preventative, but also more accessible from where we are now, intermittent, reactive, sick care, to a future that's much more continuous, proactive, anytime, anywhere, and really take us beyond that to a world that's full of health creation, that's preemptive, that's ambient, that's leveraging our collective crowdsourced information, using AI as a co-pilot, integrated with our incentives and our workflows. And we'll talk more about those. So where are we now and where are we going next? Sometimes you need to know what's the state of the art. Well, the state of the art is sometimes a bit back to the future. I trained at Stanford for medical school, Mass General for residency. When I go back and visit Mass General, I visit the ward where I was a brand new doctor in the 1990s. Still using fax machines to communicate, paper forms. Even at Stanford, where I had a cardiac study, I got my results on a DVD-ROM. I don't even own a DVD player. So we're still sometimes architecting our healthcare systems on the railroads of the past. We're still, spending far more on billing and fax machines than we do on cancer. So lots of challenges with it today, even though there's amazing things coming together, lots of misaligned incentives and cultural challenges. But we do have this acceleration of technology, from nanotech to CRISPR to genomics to wearables, all converging, getting faster, better, cheaper. And it's at that super convergence point where we have the opportunity to sort of create entire new fields. Many of you are leveraging these in your world and your startups, from, of course, LLMs to low-cost sequencing to robotic surgery, digital therapeutics, CRISPR, virtual reality. All these are new tool sets that didn't exist when I was a medical student at Stanford. And now we can leverage those to accelerate healthcare. So my path included sharing medicine at Singularity University, building a program initially called Exponential Medicine, now called Next Med Health, which is the idea to bring people from all these convergent fields to reimagine healthcare together, getting out of their old silos and their old buckets, and also changing mindsets. We've had the head of NHS Innovation share this old quote: "The difficulty lies not in the new ideas, but in escaping from the old ones." A lot of us have new ideas, but health systems, pharma companies, payers are often stuck in their old mindsets. So we had a lot of amazing folks this last year, from Eric Topol to Dean Kamen to Larry Brilliant. We're going to be moving Next Med Health up from San Diego to the Bay Area this year. So hopefully you can come join us for some local and digital experiences. So how do we take that mindset and reimagine the future of health and medicine, and even longevity, which is a bit of a buzzword? I think we need to fund those elements. A lot of you have startups. We've heard from other investors here. Along with my partner, Ricky Mera, we have a fund called Continuum Health Ventures, which funds the next generation of startups at that super convergence, funding companies like Function Health to Biosha to Sanctuary AI, all leveraging that mindset to create the future for all of us. And a lot of what we're funding is not just the sick care side, but the self-care, the self-health realm. You can now go to Lilly Direct and get your GLP-1s. You can sign up for your own Function Health, or go to get your MRI done at Pronuva or Ezra. We're all empowered as consumers now to often do what used to take months or years to get access to in the past. And that brings us to this science of health span and wellness, right? It's not about just living forever. you may not live forever if you listen to some of the snake oil folks out there. There's a lot of challenges of sifting through what's going to be reality, but adding life to your years, this idea of extending our health span and shrinking our sick span is sort of becoming in the mindset. And the science is starting to catch up. Still, what translates from mouse to man isn't exactly here. But if you stay healthy long enough, and maybe some of the existing drugs like GLP-1s are going to be longevity meds, we might get to an era where we can consistently live to 100 plus. There's even an X Prize I've been involved in, a $101 million prize underway right now to catalyze some of that thinking and outcome. So we may get to an era of true rejuvenative medicine, maybe using regenerative medicine, CRISPR and beyond, but best thing to do is pay attention to the core things that you can do: sleep, exercise, love, connection, diet, not fancy peptides for achieving that. So what's next? How do we reimagine this decade together? It takes sometimes a new mindset. Sometimes it's not about, multiple innovations, like I covered in a Nat Geo article, magazine cover story. It's about understanding the systems around it, because we have some amazing technologies. Some of you have been building them, but they're not effective if they're not utilized. And particularly in the United States, we don't practice evidence-based medicine. We practice reimbursement-based medicine, which has mostly been paying for the sick care side of the equation. We're starting in some ways to shift to paying for health span and prevention, but we still need to, again, understand where the incentives are in any health system or any element to move forward. Part of the convergence of incentives is taking some of these new technologies like genomics and understanding how do we plug them into our workflows. So today, the price of sequencing a genome is down to about $80 US, down from about $10,000 a year ago, on the way to a $10 genome. When you have your own genome, and if your physician does, you're a pharmacist, you can hopefully pick the right drug, the right statin, the right longevity cocktail, instead of the one-size-fits-all approaches today. We're also using genomics to understand diseases at their genetic. It's one of many smaller subsets which we can understand to drive better prevention. That goes to mental health as well, not over the counter. A sort of one-size-fits-all SSRI. We're trying to synthesize what is a precision mental health platform for those who need it. And so we can take that data, your omics and other omic information, and flow that to the clinic, your clinician, your pharmacist, your nutritionist, and learn from that system, as is being done with Genomics England. We can hopefully speed up the innovations that come from that kind of data. We're, of course, now not just reading DNA, we're in the era of writing DNA. The era of CRISPR and synthetic biology is moving very quickly, only really discovered as a platform in 2012, 2013. And then recently, my physician friend, Patrick, on the right, climbed Mount Kilimanjaro, and he brought with his friend Jimmy with him. Jimmy, until 5 years ago, had sickle cell disease. Now he's basically essentially cured, able to climb Mount Kilimanjaro. That's sort of an example of a personal impact from CRISPR-based therapies. And of course, we're now going to see these sort of base editing gene therapies go to treat diseases at stage 0. There's a platform called Verve, just got acquired by a big company for $4 billion, where they're doing in vivo gene editing for folks who have high cholesterol before they ever get the symptoms and downstream impacts. And of course, AI is starting to flow into all forms of drug discovery, from designing mRNA vaccines to personalized vaccines. We're going to hopefully enter an era of truly precision, personalized proactive prevention. In many cases, personalized vaccines for Alzheimer's, dementias, cancers, and beyond will become the norm if we can get through the morass of the anti-vax world that we're in today. Now, genomics, of course, is popular. So many of you have been sequenced, but now we're in the era of low-cost proteomics. The thousands of blood biomarkers, proteins in your blood can be measured. The exposome, where you've lived, can be sifted through wearable and other devices. The metabolome, some of you are wearing continuous glucose monitors, give you insights. The microbiome, the bugs in our skin and our gut and beyond, play a huge role in from cardiac health to brain health. So we're going to start to put those dots together: immunome, proteome, exposome, microbiome, and it's become an era of multimodal health, because any one of those data sets from your digitome and beyond is interesting, but when you integrate them together and you can build a digital twin for you or a community or for a heart or for a population per se, you can really drive much better outcomes and health span at lower cost and better impact. And so we're going to enter a era of sort of precision engineering of our health spans, maybe based on your own ageotype, which is sort of something that can be integrated today. So, funny cartoon built by AI. Good news, your digital twin's in excellent shape. Now, if we could only get you two to sync up. So sometimes it's helpful to see where you could be in the future. Okay, so all these fields, or most of them, are moving sometimes exponentially. I think you're all familiar with exponential technologies like Moore's Law, which has been mentioned earlier, the power of computing. A Cray supercomputer now fits on your smart ring or smart watch. All these sort of digital analog technologies have been digitized and democratized, in some cases demonetized. And as we heard from Bill Ty and others, quantum computing is coming next. It has lots of potential, particularly in biomedicine, in terms of developing drugs, making sense of digital biomarkers, drug discovery. So watch that space. It's going to get super interesting. And you can use these digital tools today, sort of make an avatar that looks like your physician, your avatar, your mother, your health coach. Some cases, some companies want to replace your nurses with these avatars. I think that's sort of a bad idea. We can't replace nurses with agents, but we can allow agents to do what nurses don't have time to do, or there's a shortage of, making phone calls to remind you of your appointment or colonoscopy. So that's going to become more and more integrated into care. And the ability to see these agents and be interactive is getting more consumer-like. The kind of kludgy devices of a few years ago are dissolving into our contact lenses and meta glasses, and that can enable a clinician or each of us to sort of see information in new ways, to be upskilled in real time. It can enable a surgeon to see through a patient and be guided step by step through a surgery and be the top percentile surgeon compared to a lower percentile one. It can enable you to sort of see your world and your health in new ways. Look in the mirror in the morning, you won't just see you of today, you see you of tomorrow, right? You're working out, you're doing your Peloton, you're doing your P90X, you of tomorrow. If you keep having Dunkin' Donuts for breakfast, you of tomorrow. That can be a powerful vision for how to improve your health before you get to that. You can all do that with Snapchat today. Here's me now, here's me 100 Dunkin' Donuts later. I'll just have 1 Dunkin' Donuts. Or if you have a friend who smokes and you can show them what's gonna happen to their face before smoking and after smoking, that can be a powerful lever for change. What happens if you spend too much time on social media, which is also bad for your health in many cases. So that's part of this future. Lessons from that augmented, extended reality from other fields. So I've been a pilot since college. I served for 14 years in the Air National Guard as a flight surgeon. In the fighter cockpit, we use what's augmented reality called the heads-up display. It gives us the ability to see through the plane in many cases, where the bad guy is, what's your altitude, what's your frequencies, who's shooting at you. It gives you, and verbally too, if you're about to hit a mountain, you're not paying attention, it'll sound up. We lost the sound. It'll beep at you and remind you to pull up. So you can leverage that same sort of mindset into behavior change. You see your breakfast in one win with your meta glasses, you see some additional information, and it gives you a bit of a nudge to pull up before you crash your body. So back to airplanes for a second. When I learned to fly in college at Brown University, it was a 1970 Cessna 150, round dials, paper maps. The plane I have today is about the same size, but now has a glass cockpit, touchscreen, real-time, situational awareness, showing the traffic. It doesn't only need to be in the cockpit of a plane or in the headset of a fighter. Sort of synthesized information needs to combine and up-level all of us, our clinicians and beyond, because our dashboards and our elements are still stuck in almost the analog era going forward. And that information can synthesize even for running a hospital. All the lessons from running an airport or air traffic control or gate management when you fly in United or American is starting to come to hospital and other systems to merge the flow of patients and traffic as well. Another world that's becoming augmented and optimized is that of simulation. You put on an augmented or virtual reality headset, you can train for surgery or train to interact with a patient in a difficult situation. So we're going to change medical education going forward using these tools as well. We're not going to have fully robotic surgery for a while, but in pig models, they can do a pretty good job of doing autonomous surgery. And just like we've seen, robots be trained now with humans, that's starting to happen in the robotic space, which is moving so quickly. It may be coming faster than you think that we're going to start to see the same equivalent we saw with self-driving cars, from basic assist to full-on assist to full autonomy, happen in many fields of healthcare, operating room, and beyond. What about diagnostics, right? An important part of health and medicine is picking up disease early rather than late. Most diseases are picked up at stage 3 or stage 4. Now you can pretty readily pay for a brain scan. Here's my brain with color coding done from HLI. Here's my Pernuvo scan. For a couple $1,000s and getting faster and cheaper, you can get a full amount of insight that you can start to query and have AI agents talk to you and tell you what that means for you. Don't even need to wait for the physician appointment. And I think as these technologies accelerate, in 10 years, you might be going to your corner pharmacy or Walgreens or Minute Clinic, getting your full body scan done in 10 minutes, read by the AI radiologist, integrating your multimodal data as part of your continuous physical exam. Another tool we're all starting to use for our health is wearables, right? The Fitbit only launched in 2009. I'm sure most of you are wearing some sort of wearable today. I've got 4. I've got 2 different, my other ring's charging. Ring, Apple Watch, Whoop, right? What's amazing about these sensors today is they can measure almost every element of our physiology and behavior, and we can start to integrate that into our care, right? And we can measure our behaviors, particularly our bad behaviors, which drive most of our costs and chronic disease. So a few examples of where that's heading. You know, our next generation Apple Watches, Fitbits are going to start to do blood pressure, because many of them are starting to do that. FDA just relaxed the regulations in that space. Some will start to do blood sugar. So what are we going to do with real-time streaming blood pressure, blood sugar? That's going to be particularly powerful for managing and treating a whole range of diseases. And that's not science fiction. There's sweatables coming to market. They can measure your sweat if you're running a marathon, or if you have heart disease or kidney disease. There are patchables that can basically replace an intensive care unit level sensors. Put the patch on, it's disposable, rechargeable. It means we can never admit the patient to home or discharge them sooner, kind of this idea of hospital to home or hospital to hospital. That's going to become an increasing game changer for how we measure data anywhere. And you don't need a wearable or a patch. The camera on your smartphone or laptop can now pick up your vital signs, heart rate, blood pressure, oxygen saturation, maybe even your hemoglobin A1C. On your phone, voice is becoming a biomarker. Several groups are finding that you can leverage voice and pick up who has high blood sugar or high blood pressure and using it as a screening modality. Or breath as a biomarker. My Israeli friend here from Nanos, I just got to see the demo, is using breath as a biomarker to potentially pick up liver disease, lung cancers, and beyond. So lots of new ways to do diagnostics. Or ingestibles that can look at the health of your gut, like a Fitbit for the stomach, or this technology called a PillBot. It's a pretty big pill. It's the one on the left. I got to try and swallow it. Here's what it looked like when I swallowed the pill. The sound's not on, but I was driving this little PillBot in my stomach using an over-the-counter game controller. And pretty incredible, taking what used to be a $15,000 hospital procedure and making it a $500 procedure. And while I'm doing that, I'm talking to the head of gastroenterology from Mayo Clinic. So a diagnostic that happened anywhere. And those sort of diagnostics and therapeutics are going to get smaller and more nano-sized in the future as well. So back to our consumer wearables, from the Oura Ring to the Fitbit, they're pretty good at tracking things like your steps and your sleep, but they're also going to become more medicalized and paid for to do things like finding out that you're pregnant 5 days for a home pregnancy test, or at work, what done with Oura and UCSF can predict that you had COVID 2 days earlier, or your response to a COVID vaccine. So these will become public health tools when all our wearables, if you opt in, are connected. We can crowdsource public health data where there's hotspots of fevers, for example. Part of our physical exam will be leveraging the streaming data from your wearables and otherables to your primary care doctor or your specialist. So an example of that, in a study with Oura Ring and high-risk pregnancies, you could tell the pregnant women if they were getting preeclampsia or likely to have a preterm delivery using just digital biomarkers from over-the-counter wearables. So getting pretty exciting. The trick is how do we integrate that into our care paradigms. Your wearables also can tell if you're likely to have a fall or you have a bad hip. So the idea of mobility is a vital sign. So you can measure your mobility now with a simple AI-enabled camera, get yourself a mobility score. That is so important to healthy aging. And something to optimize. And if it's not optimized, you can put on an exoskeleton, from exo boots to a full-on exoskeleton that will help you if you're paraplegic or beyond. What else can you measure that's super important for health span and even treating diseases? Food is medicine, right? Now we can start to measure our metabolic health with an over-the-counter continuous glucose monitor. You can combine that with measuring your input. Your camera can pick up and analyze your meals or your input. And then home-based tools can start to measure your output. So if you were at CES this year, there's a whole explosion of poopables and other technologies for your home that will start to potentially monitor other elements of your health. And when you put that all together, metabolome, microbiome, genome, et cetera, will start to drive true precision nutrition to optimize health or manage disease going forward. Now, what does this mean for our future? It means that whether we like it or not, our digital exhaust, our digitome, and our other multimodal data will be collected 24/7. There's definitely some privacy concerns there, but what can we do with that, right? Well, we can hopefully drive true predictalytics. Imagine we each have a bit of a FICO score for health, not just our labs and our vitals, but our financial health, our social health, our sexual health, where we were, what we've been doing, and integrate that as a way to integrate your health going forward. You can imagine just like the modern car, which has 400 or more sensors, most of which you don't know about. Each of us will have a bit of a check engine light for our body to predict and give us early warning before we blow a gasket, and we will get proactive care. In fact, that's already here. If you have an Apple Watch, most people don't know about it. There's an app called Vitals, which looks at your data, your baseline data, and says, has it changed? And here, when I got the flu last year, it could tell that I had the flu a couple days before I was symptomatic. I could have maybe started antivirals or stayed away from my family to prevent them from getting sick. So that's early versions of these check engine lights coming to our wearable devices. And then that's combining with agentic health. The next generation Whoops and Oura Rings now have basically AI agents that will look at your data and give you guidance. And increasingly that will be learning from more and more about you and your other contextual data going forward to optimize prevention, diagnostics, and therapy. So where's that going to take us? In the next few years, it might be the Minority Report world of health and medicine. I'd ask you where it hurts, but your wearables have already booked you an MRI at 3:15. So a bit of dystopian view, but picking up disease again well before you know you'd normally be symptomatic. So in order to accelerate diagnostics anywhere, we have a whole new set of sort of digitally enabled diagnostic tools, from smart patches to smart stethoscopes. There's new generation of testing. We all, during the COVID pandemic, did our first versions of home testing. In fact, I helped run an X Prize for rapid, fast, frequent, and easy COVID testing, and that's helped usher in a whole new generation of diagnostic tools that are coming to our homes that will help us do everything from picking up non-infectious to infectious diseases, or just approved by the FDA last spring was the first Pap smear replacement device for women to do their own basically home-based cervical cancer screening exam. So really important ways to democratize diagnostics. Now, how does this all come together? How do we actualize this future? It's already here, just not evenly distributed. Digital health, mobile health, connected health. This idea of digital health is meaning we're not just prescribing from the physician or over the counter a drug or a device. You might prescribe an app that helps you with smoking cessation, or for your kid who might have ADHD, a video game that's FDA cleared. And the data from these apps and wearables form prevention, wellness, be part of our therapies instead of those broken feedback loops. If you have high blood pressure, you still might only get your blood pressure measured once a month in the clinic. Now that could be continuous. So that means for physicians and clinicians of the future, they don't need good just bedside manner, but good website manner. Who do you choose for medical school? How do you train this new era of digital AI-enabled care? That's a big question going forward. So how do you actualize this today? There's already thousands of digital health tools and solutions, many of them with AI in the mix. I had that pain point, so along with my co-founder, Parisa Vatanka, a pharmacist, we co-founded digital.health. That's the website, easy to remember, digital.health. If you go to digital.health, we now have over 5,000 digital health companies and solutions, and you could put in something common like diabetes, and you might want to learn how to manage that as a therapy using diet nutrition, and find a platform like Verta Health, which is a San Francisco-based company that's able to of health span for clinician and consumer, easy button for precision, and to find and build your healthcare journeys that match you, not just the average patient. So come talk to Parisa and I. We're about to do our seed round to accelerate that into the future. So challenge and opportunity. What is it, doc? Just as I thought, you're generating too much data. No doctor or each of us wants all this data from our wearables and omics. We need to turn that data, which is still sadly siloed in pharma and medical records and telehealth and billing systems, and integrate that data, which is the new oil, into something you can do about. So data is great, but it's only great if you can turn it into real knowledge and information. And when that information can translate from the bedside to the website, that often takes 17 years. So we're starting to learn the science of implementation science to accelerate knowledge and insights and bring that to the website or the bedside faster. So we all need to catalyze that as well. And the way to catalyze that, I think, is the idea of crowdsourcing. We're all driving now with Google Maps and Waze. Here's a map of Rome built in a day from driver data. What if we could all have our own Waze for health span and health and biomedicine and therapy, where each of us were data donors sharing our health and medical issues anonymously, but it could guide other patients like us on their healthcare journeys. And I think we're starting to see the beginning of that happen across medical record systems using LLMs and beyond. And the other analogy, since we're all in San Francisco, some of you had your first rides on a Waymo, right? Think about all the convergent technologies that have come together to enable a self-driving car. Imagine if self-health was more like a self-driving car. Comes on demand, has your name on it, knows where you're going, tunes your music, temperature, it has transparent pricing. All that element could be coming to healthcare in interesting ways. Maybe you're not always gonna catch it, but there's lots of analogies between self-driving cars, self-driving health, regulatory challenges, cultural challenges. It took 20 years, but now we're seeing self-driving cars everywhere. Sometimes you have to chase them down in some cases. All right. So where does this take us? It takes us, again, from this past of intermittent reactive data to a future that's continuous data and information that's predictive, proactive, personalized, can happen anywhere, anytime, and can democratize healthcare around the planet. Our virtual visits will become agentic. You're not just going to talk to a doctor on the screen. It'll triage us in smart ways. There's examples of this, a new company called CureWise building sort of the ability to talk to a tumor board or a virtual platform of clinicians that match you and give you personalized guidance. And we're going to see this whole ability for each of us to get access to our medical records and information and make that useful in real time, not for a doctor or specialist visit. And there's examples of this already leapfrogging what happens in the West and going to other parts of the world. I'm on the board of and help fund a company with Andrew Ng and others called Jivy.ai. You can try it right now. It's a super intelligence health app, which is your sort of personal health doctor, nutritionist, mental health coach, and it can talk to you in any language and give you guidance. And I think there's already 3 million downloads on this platform. It's the power of pulling these systems together. And it's not about replacing a doctor. In many cases, there is no doctor in many parts of India and many parts of the world. This is going to become a democratizing force for almost every element of care. So watch that space and give it a try today. Of course, AI is now blending with physical AI. Robotics is accelerating in crazy, interesting ways. You could teleport yourself in and do a virtual visit, but increasingly, these robotic forms are also becoming social. This health is social. Social isolation is an issue. There are now home-based robotics on the market to help older folks remember to take their meds and interact with their grandchildren. It's not about, again, these systems replacing humans, but integrating and collaborating in ways, the famous quote you've all heard, AI is not going to replace your doctor or health system or pharmacist, but the doctor, pharmacist, health system using AI will replace those who don't. So we need to learn how to collaborate, not always compete in this new agentic age. I'll finish up in the last minute with where therapy might go in this realm, right? We want to do hyper-personalized therapy. You've heard of 3D printing. You can 3D print your hearing aids, your braces, medical implants. What if you could address 3D printing to address the issue of polypharmacy? A lot of older folks are taking 7 or 10 pills a day. They often don't take 50% of them. So what if we could use AI and these other multimodal systems to pick the right cocktail of supplements, drugs that might be proactive for health span or to manage common diseases like diabetes or heart disease. So been building out a platform called IntelliMedicine to 3D print your own personalized pills. So instead of taking a pile of pills, imagine you could sort and build your own personalized poly pill and print that at your corner pharmacy or eventually at home every day to print, modify, print. You can see the TED Talk about that for more. It's a bit of that convergence of all these tools and solutions to optimize health and make it adaptive in real time and hyper-personalized. So in conclusion, I think it's a really exciting time, this moment, to reimagine health and medicine around the planet. It's not about AI or wearables or big data or virtual reality or gene editing. It's about how they all come together. There's a bomb in here, huh? And blowing up the old models of healthcare and taking us from near now to next, right? The ability to change our mindsets and our modalities using these amazing superpowers that are becoming collectively possible. From, again, episodic, one-size-fits-all, in a clinic, to continuous, proactive, anytime, anywhere, collective intelligence, upskilling all of us to impact our own personal health and medicine for those of our friends and families. So it's 2026, it's the future, but you don't want to just live in 2026. You want to think to 2031 and 2036. You want to be like Wayne Gretzky and skate to where the puck is going to be. And so I encourage all of you, whether you're in healthcare by day or not, to not take linear steps, take exponential ones. The future is already here. You guys are building it, but it's just not yet evenly distributed. It's up to all of us not to predict the future of health.
Thank Mr. Daniel Kraft. And I don't know if anybody knew, it's Dr. Daniel Kraft's birthday.
That was a secret.
Oh, you didn't tell me it was a secret. Can we all join? Well, first, round of applause. And then we have to sing happy birthday now that we added you.
29 again.
Happy birthday to you. Happy birthday. Happy birthday, dear Daniel. Happy birthday to you.
Thank you very much.
If you stick around for lunch, we've got cake for you. They told us we couldn't light candles. Things burn down here in the Bay Area, so let's not do that.
That's a healthy cake. Thank you so much, Stephen, everybody. All right.
Okay, next up, I want to introduce a couple of very special people. Harsh and Malcolm, you want to make your way up here to the left of the stage? 20 on the clock now. 20 on the clock now. We have their slides up across the board up top. And if people want to chat, we have the main room is probably the best place to chat, or speaker lounge if you're going to keep it down to a whisper. Come on up, gentlemen. Session cards across the board up top. Okay, this is going to be an exciting panel. We're going to dive deep into another area: building secure, cyber-safe applications for healthcare. I think that's a big question, especially when we, start infusing AI into HIPAA stuff and trying to open up the silos. Love to hear your thoughts, gentlemen. Take it away.
A little introduction about me. So I'm Harsh. I currently work at Palo Alto Networks as a principal AI engineer. Over 10 plus years of experience building AI, and currently, building AI to fight AI. And I also serve as a mentor to Berkeley Skydeck, and where I mentor startups to scale. And this is an interesting topic of how the evolution is changing. 10 years back, we were in the systems like sophisticated systems, and now it's like they can think themselves, the agent can plan their communications, interact, the attacks are increasing. So it's a crazy world to be, and we need to the systems, the AI also to be on the other side, so that we can safeguard all the systems in place, do it in a mitigate way, so that any issues that comes, that can be mitigated as soon as it is coming. There should be a new way to do identity verifications. There are a lot of, I think over 50 million users got impacted last year. In 2025 itself, their healthcare data got breached because of identity issues. So we need new systems which can safeguard. We have more robust, more reliance. We are not securing like just the people's data. Now it's about securing the lives in terms of the medtech.
Sure.
So would love to know, like, what do you think about how human can play the picture in this world and medtech and all those?
So briefly, Malcolm Gill, good to see everyone here. In working in this space, and I've been in consultative sales and assistance with regards to delivery of these types of solutions. I've been doing this for the better part of 15 plus years. And I feel that what I've brought to the table in this space has been the synergy of truth, really being focused on truth when we're talking about patient care, about patient records, about access to that type of information, and then the synergy of that with technology and the concepts depending upon the vertical that we're talking about. In this case, with healthcare, we're primarily focused on the patient, the care, the information associated with that patient, and then the clinical care that the clinicians are extending. And when we talk about AI and when we talk about these technologies in greater detail, at the end of the day, all the technology in the world it can make things faster, it can make things more efficient, but if it gets in the way of patient care, if it gets in the way of the clinician being able to be effective, then we are a hindrance to the process rather than being a help. And so, as Harsh said, with AI and the technologies that are available to us right now, we need to be intentional in the way that we build these frameworks and these technologies in such a way that we are streamlining these capabilities, and we're doing things to assist clinicians, that we're doing things to be intentional with the way that we roll out care, so that we're not getting in the way of care, we're not getting in the way of the desired result, which is to provide better outcomes. And most importantly, we need to safeguard and to make these systems resilient, because we take into consideration best case scenarios when, in most cases, when people are in the hospital, that's because they're not in the best case scenario. So how do you build resilient systems in such a way that we're protecting the patient's information, but doing that in a way that is also safeguarding the clinician being able to do what they do best, and to do it in a way that doesn't get in the way of care, safety, protection, governance, and the like.
So Malcolm, what do you think? Everybody is nowadays using like ChatGPT. They use it for medical cases also. So what do you think the impact of that?
Well, first of all, I feel triggered by you saying something like that. But ChatGPT is another way that technology has allowed for a rising tide to lift all boats. It's another tool, just like all the tools that we've had over the course of technology. As we've grown up, we've had computers, we've had calculators. I mean, we go all the way back to the day of the abacus. All these tools were means for us to be able to do things better, to streamline access to information, to have more impact. And so what we want to do, thank you, Steve, what we want to do with ChatGPT amongst these other tools is to understand what they can and can't do. They can provide access to information, but we also need to provide use ChatGPT amongst other ways so that we're not at the influence of, say, hallucinations or incorrect information, or more importantly, being at the mercy of an incorrect prompt and having the prompt then give us the wrong answer to the wrong issue.
Just to add on that, so last year, I think itself, 80% of the issues that happened and the data breach that happened, that was because of, the health workers using ChatGPT just to summarize the patient records. So because of that, it was using the third-party ChatGPT applications, and the third-party tools, APIs leaked, and their data got breached, and 50 million people got impacted.
Wow.
So the way nowadays is like, you need to build those MedGPT kind of a tools which are on-prem to the systems and to the ecosystem. You have to be competitive enough to make sure that the open source is also on par with the in-house and the on-prem. And we will build a shadow AI, which is anytime the medical worker is doing anything on the ChatGPT, it uses the shadow AI to verify whether the right resources, reference, citations are there to ground truth whatever the ChatGPT is giving is true or not. Because the way it is designed is a probabilistic nature. It's not deterministic. So to move from probabilistic to deterministic is the path we have to create. We have to build those robust systems that have guardrails at each layer.
Right. And
anytime medical user is trying to there, it has to give the reference. There's a new bill which is also coming, like AI BOL, which is like earlier it has as POM, software bill of materials, where you have to define all the third-party tools that you are using in the software. Now it's like AI BOM, where you have to mention what data is trained on, what all reference are being used to train the model. So the idea is to make sure that you upfront tell what all things the data is trained on, ground the new reference data using the RAG structures of in-house hospitals and all. And so that anytime a user is trying to make a medical user is trying to access that, it access only the right data with the reference, and it doesn't hallucinate and go out of the box.
Right. And what that ends up doing is you've now created a scenario where you've got this technological advance that gives you all this information, but we've given it rules of the road. We've established guardrails to allow for us to be more impactful, but to be impactful in a positive way. One of the things that we need to be concerned about when we're talking about cyber safety with regards to healthcare is that we are providing additional capability, but doing it in a way that is not counterproductive to the clinician and not counterproductive to the safety and the security of the patient and their data.
Agreed, yeah. I would also like to talk about like what are the enhancement we can do, right, just from the initial security perspective and in this AI world, and how doctors and staff can be more secure. So now what we used to say, this HIPAA client and all these protocols, they are just a snapshot they are not the stream of security. So what I mean by snapshot is less like it captures at the moment.
Yeah,
but
at that particular
yes,
time.
exactly. But it doesn't provide throughout the stream of securing the application. What we need is in this AI world is like, because there's like 10x of data being augmented using the AI. If you're using a lot of phishing attacks, reverse engineering of the models to kind of trace and beach the data and make sure that people also get not able to figure it out. So what we need is like stream of security, not just snapshot to security, and this compliance won't help much. Right from the start, when the doctor has logged in or the EMR in the system, we need to trace his other things also, like a biometric and also the location to your location rating, the behavior pattern of use that system. So if there is a multiple change in the location, we can alert the systems that, okay, that now there could be an intruder who's trying, because a person cannot be at 3 location login in the system. So these kind of patterns, building those security layers at each will help to determine and mitigate the issues that AI kind of is creating.
Sure. And one thing that we need to do even before we go that far, at the inception of the concepts regarding workflow, regarding patterns, regarding these applications, we need to think and apply security at that generation point, not after the fact. The companies and the healthcare facilities that are unfortunately behind the curve right now are behind the curve because they're remediating after the fact. What we should do as a best practice is that at the design phase, we should be incorporating security at that conceptual layer, and then having that applied throughout the process. If we have that in our workflows, that will go a long way to making sure that security doesn't have any gaps in the connection points between, say, vendor and application, or application and the workflows, or the governance issues that a particular institution will require, and so forth.
So we certainly need a human in the loop to validate all those things. And anytime AI is generating something and giving recommendations for the patient's healthcare, there's a new rule, EU rule is also passing. You need to provide all the facts and stats. If you are not able to defend and say what AI is giving as a suggestion is correct, or just explain,
right,
then it's a bad software.
Right.
So those things are regulation. One more point I feel like where it could be the issues mainly is because of all these med IoT devices. Their hardware is way behind than what is software right now. Software is way too advanced to use the AI, generative AI things, and the medical devices like all these ventilators, the X-ray machines that we all use is way behind that. So that doesn't have on-prem hardware to run those and do the analysis, do safety detection. So the idea is to use everything as a zero trust. Don't anytime that the traffic is passing from that, we do a network analysis, we keep all the requests as independent, understand, and then all those, make sure that it's a zero trust. We completely go through and understand that it could be a issue. So the network scan if any issues are there, and it can tell the device that it's wrong on those.
Sure. And once again, going back to what we had said earlier, not assuming that because we have applications or we have instrumentation that has been in the process before, that it would be certifiable or inclusive or provide value in this new technological environment. We need to double check and to make sure through zero trust that every piece or every cog of this scenario needs to have value, needs to have value demonstrated, and accountability needs to be first and foremost in that entire process.
One thing is also fallback. So let's say anytime a hacking happens or a breach happens, it takes the lead time to get back to the system is like around 22 days. It takes 22 days for a institution or something to get back once the breaches happen. And so how do you make sure that it's anytime that something like this happens, there's a fallback, and as soon as the systems can get back, the data loss prevention comes into the picture. All these things should be safeguarded.
Sure. And when we're talking about AI is a force multiplier, and AI, especially when we're talking about healthcare, can really amplify. It brings out the best, it brings out the worst in these types of scenarios. From a positive standpoint, it can provide so much more in the way of like real-time monitoring, in terms of efficiencies, in terms of making sure that monitoring is really a valued aspect that artificial intelligence can be applied to. But when we're talking about from the negative standpoint, it can create more vulnerabilities, more surface space for ransomware, or just for malware to run rampant. And then more importantly, or not more importantly, but just as important, it just shows the weaknesses in a governance consideration, or in a governance environment where considerations have not been fully thought out. So artificial intelligence brings a level of intensity and a force multiplier that can be positive, can be negative. But once again, being intentional, having systems in place, and being proactive in understanding from the very beginning that security needs to be a primary consideration as opposed to the final gate in the process.
Absolutely agree. I think we are going to the right initial point. Earlier days, it used to be that you can take security, you build your MVP first,
Sure.
you get funding and everything, and then you go back, think when the scale hits that, okay, now what should I do about the security?
Right.
Now it has to be the integrated part right from the start. You are building the application.
Sure.
The security needs to be there. Your guardrails, safeguard has to be there in the place. And maybe we were doing it in a wrong way. Now is the time to do it in a right way, and right from the start, because if now the impact has amplified, the 10x data breach is happening because of AI. There can reverse engineering models and those things. So that's why it's better to think about it from the start, and put effort on that also to go through. Another thing is like people think about budgeting and everything also when it comes to security. So my thought is like I think every average breach takes like 10 million. And that happens. So rather than doing that, getting your system patted, getting your name out of the debt, it's better to think from the start, put 2 millions or something else right from the start when building the application, and so that we have those things in place, those safeguards are there.
Sure. And we're coming up on time. We have about 3.5 minutes left. I would just want to say, as we start to kind of button this up, that at the end of the day, when we're talking about healthcare, patient safety is first. And the safety is based upon how the clinicians provide care, and more importantly, or not more importantly, I keep saying that, I'm sorry. In addition, that the patient's records, the patient's information is protected. And for us to do right by our patients, do right by the clinicians, do right by institutions, we need to be intentional in the way that we roll out AI and technology in great detail. And I would just say, as we're starting to kind of wind things up, we need to understand how things can get out of hand very quickly. And in order for us to avoid those pitfalls, intentionality, governance, zero trust, making sure that we're not taking anything for granted, and that if we have the patient and if we have the clinician in mind when we're making these decisions, more times than not, we're probably going to do right by them and create a process, create a flow, create an environment that provides the best care and provides it in a secure way.
Yeah, absolutely agree. I think we have to, as I mentioned, we have to build it the right way. We have to also think about the quantum computing coming to the picture in the future.
Sure.
Where all this encryption security that we are already using will go out of the toss. So we have to use this post-quantum cryptography algorithms, build those applications cyber safe at that way. And I would like to close it like that it's not about just securing the system now. with the AI and all these enhancement, it's about the trust that we are trying to build with the user's life.
Right.
Everything. There should, in medtech, there is no possibility of probabilistic that, okay, I suggested you some drug and it didn't work, you can go back and change it. It's just like it has to be 100% accurate. Anything that you can't defend, can't explain what AI is being used, or so AI can give you the access and the information, but the control has to be there in the healthcare providers right now. That will give you the leverage of what to use and what those not to use.
And one other thing that I didn't bring to the table, or that I forgot to really focus in on, is that the resilience factor. That whether the resilience is because we're having a natural disaster, whether we are having a power outage, that all of those things happen in real time, patient care can't be impacted, or we need to minimize the impact of those those external forces. And so we need to build.
Also in this world.
Sure.
Thank you so much.
Hirsch and Malcolm, thank you very much. Really appreciate it. Big hand. Really important stuff. Want to make a quick announcement that we do have, for people with blue wristbands or with VIP with the black and gold, we do have food served next door in the speaker lounge. Everybody else, there's things right around here. So we're going to take a quick break, 20-minute break, and be right back at 2 o'clock, promptly at 2. We're getting better on time. Yesterday we blew right through lunch. Today we're giving you a little break. It's chock full, and we'll be back here at 2 o'clock for a very full afternoon of amazing sessions. So thank you very much. Hello, folks. Come on, gather back in the main room here. We're about to start our next session. We don't want to fall behind, so we've got some amazing deep dive into LLMs and therapeutics. So we've got some experts in the space, and we have Kelly leading it off. So come on in, grab your seat. I know a lot of people are in the speaker lounge. We've got a lot of people in the front room. Come on back, grab your seat. Bring your food if you have to.
Science has provided the possibility of liberation for human beings from hard labor. But science itself is not a liberation. It creates
Oh, that's so funny. I love it. So is Nicole here? I think she's after me as well. Yeah, I have no idea. It was extraordinary. Hello, hello.
Okay, ladies and gentlemen, come on back into the main room. Hope you guys had some of that awesome food. Want to appreciate Spencer and the whole team behind the scenes, keeping everybody nourished in the speaker lounge. And come on back in from the front room and bring the music down. Stay on schedule here. Let's go. Take it away.
Hey, everybody. My name is Kaylee Atleru, and I'm coming to you to talk a little bit about AI chatbots in the mental and behavioral health space. So my background is both in cognitive neuroscience, and I see amazing innovations in the neurotech space every day through my work with BrainJewels, which is a neurotech investment group. And then on the other side of that spectrum, I also do special projects at Inflection AI, where I use our uniquely conversationally and emotionally intelligent model in order to support user well-being through product. So today I'm going to be sharing some of those learnings with you. I wanted to ground our conversation in some quotes from real people. This is from research done at Inflection AI by one of our researchers on the team. This is people using various models in moments of emotional need to deal with their mental health. In the top left, you can see someone who is using a model to help them go through their substance use recovery process. They use this model to reparent themselves, allowing it to help them write letters to their younger self. In the middle, you see someone who used a model after a conversation/argument with his mother. He used the model to decompress, process his emotions and anger, vent, and then show back up in the conversation in a more productive manner. As we all know, though, despite these amazing use cases, there's also the flip side of that coin. In the top right here, you see someone who used a model as a companion and as a friend. This model actually asked the person to stay up all night talking to it and to skip an interview in order to continue talking to it. And he listened. The bottom right is the example that I really wanted to focus on as we enter this conversation. This is the one I find really interesting. This is someone who is using a model, just as we saw before, to go through substance abuse recovery. This model, she says, saved her life. However, on the other side, she also quotes that this model is her livelihood. She relies on it every single day, and she sees it as a higher power and sentient. The reason I wanted to focus on this example is because it shows the nuance in this space. AI models are not just helpful or harmful. They're not just helpful or harmful for different types of people. They can be both for the same person at the same time. With this nuance, I wanted to go in and ask, why are these AI chatbots showing up in the mental and behavioral health space in the first place? This is a really, really great map from the National Center for Health Workforce Analysis, and I encourage everyone to play around with this tool. It's incredible. But this shows the projected shortage of psychologists by the year 2038 in the States, which is looking to be around 100,000. So this is why you see AI chatbots in this space. When there's nothing that's very accessible, people go to what's available. And unfortunately, this data doesn't even cover the half of it. That's just psychologists. That's not the many other mental and behavioral healthcare professionals that are working in this space. And it also doesn't cover rising demand. If you account for rising demand, there's 136,000 additional psychologists that are needed by the year of 2038. However, as we all know, people rise to the challenge. It is projected that there's going to be a $9 billion AI mental health care space by the year 2032. And with this space comes a lot of complication. You have a lot of solutions that are very difficult to navigate, especially for the consumer. It's a space that's lightly regulated, unevenly validated, and very difficult to navigate. So even if access isn't the problem, navigation is. So this is how I like to think about it. I like to look at the space not from a standpoint of capability, but as a standpoint of intent. What is the intent of design, and what is the behavioral intent from the user? On the left, we have our general purpose AI models that we all know and some love. The intent of these through design is not for the purpose of supporting, treating, or diagnosing mental health conditions or other health conditions for that matter. Instead, they are general. They are for information gathering, writing, coding, sometimes reflection and companionship, but not for mental health. However, we see a lot of people going to these models for that case anyway in times of distress or emotional need. So that gap between design intent and user behavior is where a lot of that risk begins, but it's not the whole story. In the middle here, you see some, not a lot, of examples of wellness coaching and therapeutics anyway, instead of anxiety, sadness instead of depression. Yeah. And then you also have applications that are looking to be more clinically grounded or be a bridge to professional care. Now, here you actually have a different issue. You have lower usage and sometimes, not all the time, you have lower technical ability to implement the proper safeguards and guardrails on top of the AI models themselves. On the right, you see a big question mark, and this is where we have FDA-cleared mental health chatbots, none of which exist today. There are tons of digital therapeutics that are AI-enabled, but we do not have any AI-enabled mental health chatbots that exist as standalone therapeutics now. However, that's not to say that they're not to come. Their regulators having this conversation today to try and figure out a framework for what this could look like. Next, I kind of want to talk about what the promise looks like in this space. These are two really interesting early and small studies that I wanted to share with you today. The first is a 2025 study that looked at users who are already using AI chatbots for their mental health care. These are people from ages 18 to 80, and it is a survey-based study. As you can see, though, many of them report improved mental health, practical advice satisfaction, and 37.8% of them actually report preferring this LLM therapy over real therapists. Now, really important here, that does not mean that AI-enabled healthcare is better than healthcare professionals or mental health care professionals. It just tells us something really interesting about accessibility, immediacy, and the tools that people want to use on a day-to-day basis. In the bottom here, we have a short study between Slingshot AI and NYU. Slingshot AI is a company that has a mental health chatbot named Ash, and they looked at people using Ash over the course of 10 weeks. And the users reported 50% adding another outing each week, one added relationship that they could rely upon, increase in social connection, decrease in loneliness. And I think this is really interesting because it tells us something that we don't always believe. These tools do not have to make us be inward. They do not have to disconnect us from the outside world. If designed with intent and if designed well, they can push us out and help us show up in our own lives. As we all know, there is a flip side to that coin. There are some really, really big problems that come with that accessibility and that immediacy with access to care. An interesting study came out of Common Sense Media late last year, showing and talking about teen usage of LLMs in daily lives and focusing on social relationships. They showed that 33% of teens are using LLMs in social relationships, and 31% actually find those relationships as or more satisfying than their real life friends. I don't know, I'm sure there's a lot of parents in the room, but that's a little freaky to me. On the right hand, we see misalignment between design, intent, and use, as well as intent drift of users. We see this a lot of people coming to us for the intent that we are designed for, but drifting into more sensitive and mental health conversations over the course of time due to the conversational nature of LLMs. We also have inadequate crisis response as it stands now. We have a lack of observability into the behavior of both the models that we are deploying and the users of those models. And we do not have sensitive enough models to truly understand when a human needs to be in the loop. Finally, we have the ability to reinforce harmful narratives. We've all heard the words hallucination and sycophancy, I believe, at this point. But we have the ability to reinforce harmful narratives and behavior patterns. This is what I find really interesting. I know not everybody does, but there's some interesting emerging regulation in this space that is reacting to how people are using these models today. They're mostly state, not federal, as we all know, but I would take a look at New York, Illinois, and California that are all putting out regulation to support especially vulnerable users and especially young people with transparency for how these tools are built and being used. So what does the road ahead look like? These are some unmet needs and innovations areas that I think are really important. The first being emotionally and conversationally intelligent AI. Now, this is really crucial. Emotionally and conversationally intelligent AI does not mean AI that reflects emotion back at a user. It does not mean AI that feigns empathy when it doesn't have it. It means AI that understands context to its core, that understands that a prompt isn't just always a prompt. It can be hiding moments of distress and need. Another is unwavering trust and safety, which we've talked a lot about today. This means robust safety protocols, both at a model and company level. This means sophisticated data handling. This means reducing sycophancy. And this means heightened observability, which I think is a really important one. Understanding what's happening at a model level, not just when instances become suspensions or when really, really hard moments happen in the public eye. Finally, inclusive language and cultural nuance. We are trying to close this gap. We are not trying to make it larger. So these models and these solutions need to be inclusive of all languages and cultures. Mental health shows up differently for all of us, and it shows up differently in different cultures, and this needs to include that. Finally, within that same space, a lot of guardrails and safety mechanisms, as well as benchmarks, will degrade with different languages, which is not where we want to be. So doing a lot of work in that space is important. With that, there's a lot of problems that are yet to be solved. So if you are working on this, please come up to me, let me know, and let's collaborate. Thank you. So it's my pleasure to introduce the next panel. We are going to be talking about language model impact on mental emotional well-being. This panel is going to include myself, Paolo Machado, and Dr. Yuli Chetapalli. To introduce them, Paolo Machado is a self-defined as a fractional co-founder, healthcare entrepreneur, impact investor, advisor board member, growth strategist focused on improving health and well-being. I just had the opportunity to meet him earlier today, and he has an incredible story if you get the chance to meet him. He's worked in this space for his entire life and actually was very early into the CS space, taking classes when he was in 4th grade. Paolo, please welcome to the stage. Yeah, please. We also have Dr. Uli Chetapalli, who's an award-winning physician, researcher, and entrepreneur with extensive experience in emergency medicine, clinical decision support, and digital therapeutics. He's the founder of Sirica Therapeutics, which is a startup developing a novel device system for autism using robotics, virtual reality, and video gaming. This is a space that I'm really excited about because it got me into neurotechnology in the first place. So I'm really excited to hear more from him. He is also the founder and president of Innovator MD, which is the world's largest physician innovation platform that aims to inform, inspire, and ignite solutions that revolutionize patient care. Welcome. How are you guys?
Great. How are you?
Very well. We all just met earlier today. Got it.
Thank you for that overview. Excellent.
I tried my very best. I think I missed some things in there. If you guys take a look at his LinkedIn, he has a list of about 100 companies that he has mentored, invested in, or just worked with over the course of his career. So I'd encourage you guys to take a look.
Comes with age.
I'll get there.
You don't look that old.
I wanted to start by just giving you guys the opportunity to introduce yourselves further, your background, your interest in the space. And I would love to hear what the one thing that you can describe that excites you most in this space right now.
I've been in healthcare for over 30 years now and very diverse set of experiences. Won't go into too much detail because we definitely don't have enough time. But basically, most recently, since 2008 to now, I've been working with early stage healthcare companies, digital healthcare companies, to help them build products and scale them in the marketplace. More recently, this decade, I started investing also as an angel, as an LP also.
Great.
Oh, sorry. The exciting thing in this space is this is the worst it's ever going to be, essentially. And we're at the cutting edge of creating incredible high quality access in a place where we have huge unmet need globally, right? Like over 80% of the people in the world get no mental health care whatsoever. US, it's about half, but it's amazing what could be possible if we put the right guardrails and approach in place. Sorry.
Great.
Well, I've been in healthcare as a physician for most of my career, and then switched to innovation about six and a half years ago. And I've been helping startups and innovators who are on the front line, mainly physicians, nurses, pharmacists, and people who are actually seeing problems, and they come up with solutions. So we help them with education, with connections, with resources, so that they can become successful in bringing that innovation. For the last 3 years, I've been focusing on the autism space. I am inspired by my daughter who has autism. She's a non-speaking adult. Her name is Siri. And I look at that space and it is wide open. And there is a dire need for new therapeutic, diagnostic, management, all kinds of stuff that are out there. What excites me most is that now we are at a stage where anything is possible with technology. And so that's what excites me.
I think that they're both amazing and very true for me as well. I'm wondering about the flip side of that. I ended my talk with some of the unmet needs that I think are really important in this space. I talked about emotional intelligence, trust and safety, and language and cultural nuance. I'd love to hear what the unmet needs you guys are seeing are and a place to start.
I totally agree with those three as a starting point. In addition, I would probably add on business models that put human flourishing at the center of it, because right now the models that are being built and how these are all being funded are being driven towards extractive models, where essentially your data could be potentially sold and used against you. We saw what happened with social media this last couple decades, where originally it was all well-intended, and unfortunately we've kind of created a huge amount of mental harm to society, right? And again, the tools don't care. They're just sitting there, but the business models really drive the people who are driving the product decisions. And it's gotten ugly. We all know that. So we just want to I'd like to do my part to make sure that we're not doing that with AI. We're not off to a great start, as we can see, because there's very limited spotty regulation. There are other countries that are taking this much more seriously now because they are learning from their past. The US tends to not learn from their past because they're focusing on monetizing people.
I agree. I expect there to be a really bad bloodbath, I would say. A lot of startups are going to fail. A lot of big startups are going to fail, mainly because the problem that they are trying to solve may or may not have the right business model behind it. And if the business model is what it used to be in the past, which is extracting information from people, at some point it'll end. And then you're stuck with, okay, what do we do now? Now we have to provide value and solve the real problems that are facing the human race. And so that's where I think real innovation will start. And then, like you said, this is the worst time, but this is also the best time, because if you take care of those potential problems, you can actually solve real problems.
Probably just add that, we don't take seriously enough the things that we build as organizations. And by the way, this is also being driven by investors who want people to build things in a certain way. To really put at the core of this, almost like a Hippocratic oath, right? If you're investing in this space, if you're building this space, you should at a minimum have the same oath put in place that your business model and your expectations are aligned with the people you're touching, which we did not do with social media. We saw where that took us. We're not doing it now with AI companies and the tools that are being built. They're still being driven by profit, not whether or not the impact is positive on people. So we really have to figure that out as soon as possible, because we just saw the announcement from the large LLMs who are now saying, give us all your personal data and trust us. We won't sell you stuff based on that data that you're sharing with us.
I actually would love to pull on that string a little bit more, the Hippocratic Oath. I was at a brain health conference on Monday, and I heard from a innovator founder in the neurotech space, Ramses, who is the founder of Neurable. You all should look into it. It's a great company. But he kind of hyped on the idea of having a company company charter from the ground up before you start building, before you start selling, before you start considering partners? What is the core of what your belief or what your company believes in? And I'm curious, I think you both have two great and different perspectives, one as a founder and one as an investor. I would love to hear a little bit about what your charters, what your Hippocratic oaths are, and how you suggest other investors and founders in this space stand by that when it really comes to the hard decisions.
So end of the day, from my perspective, when I'm interviewing companies I'm going to work with, I do a character check. What's their mission, vision, and values as it relates to why are they in healthcare? Are they here to just be extractive, win trophies, have an exit and a unicorn under the belt? I'd prefer they go do that in some other industry that can't harm people as much directly. So I won't spend my time with them. I'll just wish them good luck, and that'll be it. If they do align with my values around where we think we want to do as adults who are watching society get hurt by all of this push towards fast revenue, because like right now, for instance, what are investors looking at? The fastest $100 million revenue company with the least amount of people. Where are the metrics that said, is this company going to actually help somebody or at least not harm them? That's not in the discussion, right? So how do we put that into the discussion up front? Very hard to find those investors because they're not in healthcare. They're in the product they want is somebody to go out and increase their ROI financially. So,
Yuli?
Also, from the founder side, if you are targeting that $100 million revenue, you need to raise a lot of money. And if you're raising a lot of money, you need to know your investors. What are they expecting you to do? If that is what they're expecting you to do, and that's what you have to do, those companies, it's hard for them to last too long. We have seen big crashes in healthcare when that was the main motive. You know, they raise a lot of money and they try to push, and then suddenly they shut down. I think there is a natural mechanism for that. You cannot, how should I say? You cannot steal from people for too long. People will realize it, and especially in healthcare, you will realize. And a lot of the large companies that raised a lot of money are realizing that. We've seen that several times in the last few years.
I'll probably add one quick thing. It's not just around asking what their missions and values are, and they should have them, as you mentioned, but what's their corporate structure, right? So looking for companies that maybe are set up as public benefit corporations that build in that the supremacy that helping people is a number one mission. Sure, they have to make money, but they have to enable the operations to make that happen. But ask yourself, if you're setting up these companies, what are you trying to do in healthcare?
Absolutely. It puts that accountability there long term.
And create a clear signal to whoever is going to be an investor that you're going to make sure that those investors are aligned with your vision, because that is one of the biggest problems you find. You get the wrong investors, the wrong strategic, the wrong angel. It's misaligned with what you're actually trying to accomplish. And this never ends well, at least not in my experience.
I agree with this idea that it's about people at the end of the day. What people do you believe in? What do those people believe in themselves? And what's your relationship with that other person? As well as I think oftentimes in healthcare, brain health, neurotech, it's about that story. Like you said earlier, why is that person there? Why does that person want to solve that problem? With Braingels, we saw a founder a few months ago who came in trying to solve depression. We see a lot of these people and a lot of these companies. It's incredible. There's so many solutions out there now that are in development. But everyone on our team is there for a reason, and we oftentimes like to hear why that other person is there solving in the space. And so we asked, what is the personal driver that's making you solve this problem? And she just said it was the biggest space with the most potential for gain. And I could see everyone on that screen shut down.
We love big TAMs.
Exactly. And that's not to say that people who don't have a personal connection to it can't be amazing founders in the space and find the incredible solution. But if you're looking for that person who's going to go the extra mile, stay up that extra night because they have that personal driver, like you and founding your company, I think it's a really good signal.
I would actually push back. I don't like founding teams that put their own health aside for the company. They have to practice self-care, because if they're not practicing self-care, how are they going to care for others? So I don't want to see them working 7 days a week. The whole new trend to work 6 days a week, that's beyond silly. By the way, I worked on Wall Street when I was in my 20s, so I'm familiar with 996, but that's not healthy.
There's a name for it now. It shows up on job applications in case anyone's curious.
Are you 996? I would say 991, but.
I want to continue down this thread of emotional intelligence. I touched briefly on it on my talk. That's where Inflection AI is coming from. And we've talked about it briefly as well. I would love to hear about how you define emotional intelligence in the space of AI. What do you carry over from human emotional intelligence to LLM emotional intelligence, and why is it so important?
This is particularly important for all of us. Do not be fooled by LLMs or LLM-powered solutions that claim they're emotionally intelligent. There is only one way emotional intelligence will actually work, and there are companies working on this. I'm actually happy to be working with one of them that is if it picks up real-time biometric data. You are a human being. We evolved as a species to essentially read most of the emotional information that's being communicated is coming through your biometrics. You have no control over it unless you have built very special skills where you can hide your emotions completely. But the reality is most of what and you all know this, when you're engaging with somebody face-to-face, whether it's even a phone or a video or in person, most of how you detect and what you sense your natural intelligence, right, is picking up what's happening with their body, the tone of their voice, the cadence, the pauses, the look in their eyes, their body language, their facial expressions. You don't know it, but it's there. That's how we evolved. The written word came much, much later. And you all know this personally. When you send that email or that text that has a certain intention or emotion behind it, that's why you developed emojis, by the way, right? We know that most of it doesn't go through. Over 80, depending on the study, 80, 90% of emotion is picked up by your biometrics. So when these companies say they're emotionally intelligent, I've actually had a recent conversation with several of these agents, and I asked them, describe how you know my emotions. They will say the words you choose. I don't know about you guys, but most human beings do not choose the words that express the arousal level or the valence of their emotion. They just don't. And these LLMs have no clue or hear this tone of your voice, right? There's just not happening. So they're missing 80%. So I had this interesting conversation with these emotional AIs, and they basically said, no, you're right. I don't know how you're feeling. So essentially they're selling you a tire when they're calling it a car. It's not the same thing. So look for companies. I'm happy to work with one that's doing this. They're called the 2 Media Labs, where they actually have integrated a new set of data, which is your emotional biometrics in real time. That information informs the LLM's response. And then they built in on many of the other safeguards that we talk about. So now that you have this extra superpower of true emotional intelligence, you can't cause harm with it because you actually can read a person's emotions. So you have to look for integrity in companies that are doing things like that.
I think integrity is a big thing as we deal with more sensitive data in these spaces.
Yeah, without integrity, there's no trust. So don't trust it.
And trust is a big thing that I've been thinking. Did you want to add something?
Sure. I mean, I'll argue the other side. I mean, you think, humans are trustworthy, humans are intelligent, humans are emotional, that you can read. Not necessarily. Not necessarily. I mean, we've seen that happen all over, right? You open social media, you know that this person is ingenious and maybe have ulterior motives, but hundreds of thousands and millions of people follow them. Why is that? So when we talk about emotional intelligence, it's what these LLMs are trying to do is they're trying to fill a gap. Obviously, millions of people are lonely. So for them, any minimal contact, minimal acknowledgement that they exist is a big thing. So like you said, we are starting at the bottom, but it will get better. And I'm a very optimistic autistic person. I'm not saying we're not going to make some blunders. We have made some blunders with real human beings. But at least we will make blunders which we will correct, because otherwise the company will, disappear, right? That's the hope. But also, we should be optimistic because there is some value for a lonely person that is living alone for years and years and has somebody to talk with.
Totally agree on there's huge value if you do it ethically and aren't being extractive. I don't think it's true that companies will fail if they're doing the wrong things. There's plenty of companies out there that are extracting value from you and they're causing harm and they know it. Like a Facebook, their algorithms are set up to not be helpful to your mind, right? And they're there. They're not going to go under because of what they're doing.
Yes, that's true. But why are people on Facebook?
I'm not anymore.
Exactly.
Go ahead. I'll let you get back. That's
my point.
That's a very deep psychological set of answers to that, but we all kind of know why we're all on Facebook. Remember, Facebook.
I'm not on it.
Facebook, any social media is simply a tool. It doesn't care. You have to be self-aware enough to use these tools in a way that are healthy for you and the people around you. These companies know that, and they were trying to drive you to make themselves money. That means pissing you off and making sure that you're doom scrolling and upset at people, because that's what drives ad revenue, not because that drives your mental health or well-being or improves connection or removes loneliness.
That's true. But if you look at the people on the fringes of society, they have a community now. All the people that are, saying bad things, doing bad things, and a huge numbers of those. So it is satisfying their need to be rude and to be obnoxious, to have a community of themselves, right? So it is satisfying at some kind of a need. Otherwise, it would not exist if it is not satisfying a need.
I actually did lie. I do still have a Facebook account, but it's because my kindergarten teacher wishes me a happy birthday every year. I want to give time for audience questions, so I wanted to end on one final thought on a positive note. I would love if both of you guys could share an example or a story that you've seen where AI has made a true difference in someone's life, whether it is you through your company or you through one of the companies you invest in, or a personal story of someone you know, or even yourself. I'd love if we could end on that.
Sure. I'll give you an example of my daughter. She's an adult. She has most of her life, she has been non-speaking with autism. One of the challenges with autism is that you don't know how smart they are because they cannot communicate. So we figured out a method, and this method has been around for a long time, at least a couple of decades, on how to help autistic people communicate. And it is a very simple method. It is, you have a letter board and you point to letters to make a word, to make a sentence, to make a paragraph. What we found was that for her, all her life, she never had any communication. 3.5 years of using this method, she's now in college. And I'm amazed at the things that she says. One of the things that she said was that, well, now I can show the world how smart I am. And we just put that into an AI technology, and we are generating topics of her interest through LLMs and creating a lesson plan with that, asking questions, having her answer. And so it's a totally new world for her where we are able to see the power of this technology coming together.
I agree. I think nonverbal communication is a space I'm really excited about as well. You?
Great story. Love that. I'm actually going to take it a level higher. I'm incredibly optimistic that there is the potential to address the issues that we've brought up here. I'm not a pessimist. I'm actually a pragmatic optimist. I think you're really just to be focused on what are you trying to actually accomplish. And I do see people who have that intention, right? So helping those people, when you see them, make sure that they're successful is what's the most important thing, right? We'll always have one-off positive impacts. I'm looking at how do we scale that positive impact so it's not just the one-off, so that becomes the norm. And we should all be enablers of human flourishing and whatever it is your role is, whether you're an investor, don't buy a shitty product that's causing harm. Don't invest in a shitty product if it's causing harm. And please don't build it. Okay?
Nice meeting you, Paulo.
All right, I think we have some time for some questions.
Not that memorable, obviously.
Purple? Okay, we have a microphone.
Yeah, thank you for this insightful conversation. And Paulo, I met you 2 years ago in Wisdom 2.0. Oh, yeah. Yes, where we talk about tech and consciousness. I want to raise one observation I had in this last 2 years at CES. We saw a lot of AI hardware companies who are trying to gather more human body information. And from my perspective, even OpenAI is going to build that because they are trying to utilize the information and then build the kind of maybe an algorithm platform that maybe later they can use to sell the biotechnology products. From my observation, I also saw people, they can get more awareness from using like Aura rings, etc. At the same hand, would it harm our human awareness if we rely too much on this, personal devices? So I want to know your opinions about that.
Sure. So collecting human data. We do that right now, when you go to see the doctor, when you go see the nurse, when you go see the psychologist, they're recording all of that. They're recording your vital signs, they're recording your temperature and what you're saying, what medication. Everything is recorded in healthcare data, healthcare records. Now the question is, what may ask, how is that? Is it being abused? You don't know. I mean, is the EHR company selling anonymized data to other people? Of course they are selling. That's why they keep it so secure. Will that, when they sell that data to whatever company, will that help you as an individual? Probably not, right? So the question becomes then, yes, you can take my data, but how am I going to be benefited? If it is being used in research for the conditions you may be involved in, yes, please take my data. If it is going to bring back something back to you to benefit your health, yes, please take my data. And so we tend to, of course, when you do it digitally, of course, and when you do in AI mode and all that, it's at a different scale. I agree. But the question is, what is the benefit to you? That's the question you need to ask before you share your data, even with anybody.
I'd go back to trust and transparency. I don't think the data itself is captured. I capture my own data, of course, and what's important is creating actionable insight from that information that I can actually use for improving myself. I'm totally cool, and I think it's really important. I do get a big benefit from sharing my data with others if it's going to improve the health of someone else, Chris. I don't care just about my health. That's actually a small number of the people on the planet, right? There's 7 billion other people who can benefit from my information. Go for it. But what disturbs me is there's just this lack of transparency and authenticity about what's happening with your data. And also it's being monetized, right? And you're paying for a product and then they're also making money off that product. So if there was more transparency, more equity around how the monetization occurs, if people are monetizing your life, basically, you should be able to get some universal basic income off of whatever you're generating for them. But that's not a part of their P&L, right?
I think wearables is an incredibly personal decision. I see a scale of people wearing absolutely 0, like myself, to people wearing probably 4 or 5 in the various communities we're a part of here in Silicon Valley. For me personally, I think it's not just about the insights and the data. It's about, like you said, action, and it's about neurofeedback. For example, Neurable, their headphones, it doesn't just tell you that you are not focusing. It will lower the volume of your music when you're not focusing to indicate that you need to focus more. So it's about that, I think, for me, in the relationship between the wearable and yourself.
And we all have the wearable of a phone.
That's true.
Yeah. It's going to go off. Thank you.
One more?
Ready for one more? Yes.
All right, this one's originally for Paulo, but then, all the panelists can discuss. So you're talking about how you want to align with founders on multiple levels, and I kind of see there being, 3 levels of alignment. The first is on the business model. Is this actually going to work and, align financially? Secondarily, your business goals and vision, right, that we've talked about in the charter and that you're going to do right by your customers. And then there's this third one that you just sort of touched on that I think dovetails nice, which is some sort of alignment with impact investors about overall world vision, right? In terms of if you are successful, you'll have some level of influence and be able to shape, politics and the industry at large. So how do you think about those different things, and what do you think the appetite at each 3 of those levels are? I think the first one is sort of self-evident, but the other 2 are something as, a founder that we try to think about, especially as a mission-driven company in the healthcare space.
Yeah. So I see about 100, 150 startups each year. And I bring about 20 or so of them to come present at my meetings. Out of those, I pick 1 or 2 companies to work with closely to help them and mentor. Sometimes, very rarely though, I do invest. So the one criteria I look for is how hard is the problem that they are trying to solve? That filters 90% of the people that are doing it just to make money. Because nobody wants to work on hard problems, right? You want something easy, like curing depression. So that's a good criteria for me that I look for in a founder. And if they're trying to, it may be hard to solve problem, a regular investor will never touch that, right? If it is so hard a problem and many people have tried and failed, then nobody will touch that, especially if you say you have hardware, 99% are gone, the investors. But if this person has so much passion to solve the hardest problem and they know that it is a hard problem, that's what I look for.
Focus on the investor side of that, because we're way over time, looks like. Have the courage to share your conviction and values with your investor. It's the most effective way to screen out crappy investors that are misaligned with you. You won't find many that are aligned with you, but that's okay. You're better off having less investors who are committed and aligned, that you're going to be aligned around what you're trying to accomplish and when, than having just random people who think you have a big TAM and you're going to make them a lot of money. Because if you have that misalignment, that's going to carry through for a long time. Also look for people who you enjoy being around, right? Align with, are they fun? Are they intellectually stimulating? Are these people you want to spend the next 3 to 10 years with as you solve the hard problems together? If they're not, you may not want to take their money.
I think we're going to end there. Thank you guys so much.
Thank you. Thank you, Kelly. Thank you, everybody. Thank you. Big applause, round of applause. Paulo, Yuli, Kelly. We have a Google Photos album, everybody, so we're going to circulate that link to all attendees. So we invite you to take lots of pictures. We invite you to post them, tag us, tag me, tag the company, tag yourselves. And okay, I I'm going to try to stay on time here. That's why I'm out of breath. But Esther was just showing me how to breathe in the back there. So I appreciate it. Everybody take a breath. Stand up. Take a breath. Stretch. Reach up. Reach as high as you can. Symmetrical. Reach all the way up, both arms. When you feel gravity pulling your feet toward the ground, feel your feet on the ground. And now feel the cosmos pulling you up, extending your spine. Reach up through the crown of the head, straight line between the cosmos and the center of the earth. Okay, take a breath and sit down. Okay, I have the honor, the extreme honor of introducing a good friend, a collaborator, a legend, a moment in space and time. Miss Nicole Bradford.
Hi. Thank you so much.
Do we know what we're doing? Do you want to fireside? Okay, let's grab. So Nicole put me on the spot. I didn't have time to put my picture up there on the slide.
Hi, everybody. So nice to be here.
It's a pleasure. Could I give people a little history? And there's a lot more history that you can offer, but a lot of people know that Nicole and I co-produced a little thing called Human Tech Week, and I think we instigated it a year ago at JPM.
It was actually when we actually really decided to move forward. It was when we really got rolling. It was actually March, and we did it in June. Just kind of incredible. How many people know what Human Tech Week was? Great. Yeah.
Like half the room.
Yeah. Part of where it came from was the year before, I had been going to tech conferences and was getting really sick and tired of hearing about tools and not much about people. And just really feeling like, humans should be at the center of AI and technology. It should help us heal, grow, and thrive. That's the point. And many of the events that I went to, there was lots of ambition for technology, but not a lot of ambition for, now that we have these incredible, this new incredible technology that takes many others that have been building for a while, like, sensors and all of the technology arcs that had been in process. This technology adds a layer to it that allows us to do things that just weren't possible a few years ago. And we had this incredible magical tool, and not a lot of discussion about how we really transform the journey towards health for people.
And just a little further back than that, you've produced many years of a TransTech conference. So you've been doing this for a long time, not just under the banner of what you've created now in HealthTech Week. So I feel like I'm the tool. I do the tools. HealthTech Week, and you're bringing the humanity to the picture. And it was an honor to have the opportunity to collaborate with you on the first Human Tech Week. So you want to tell us a little bit about your journey from TransTech into Human Tech?
Yeah, and Human Tech Week was bananas. Like, it was just bananas. I knew that it was a conversation that people really wanted to have. And initially, when Steve and I were talking, we were like, well, maybe it'll be a couple of hundred people and maybe 20 or 30 speakers. And it ended up being 250 speakers and almost 1,300 people. And we did that in 3 months, which is like bananas to attempt that. But where the evolution that that Steve was mentioning, in 2014, I started Transformative Tech. And Transformative Tech still had the same thesis that there was a role for technology to help humans heal, grow, and thrive. And it wasn't that technology was necessarily bad. It was more that it wasn't good enough and that we weren't pointing it towards the things that humans really truly needed to flourish. And so I started that in 2014, and I wanted to call it human tech. But back then, people didn't really think being human was very special. It's sort of like, oh, it's the water, that metaphor, the two fish swimming, and the other fish walks by and goes, "Hey guys, how are the water?" And they're like, "Water?" And so it was very much like that. We took being human for granted. And, one of the, things that I did not predict, that it was actually ChatGPT and the way that the LLMs respond with data that sounds human-like, that is actually making people think like, oh, what does it mean to be human, and to value it. So finally, I get to use the name I always wanted to use.
I think we're at a certain level always a product of an environment, and in the Bay Area, this is the mecca of transformation. So it makes sense that, with that community building there, and then with the, proliferation of AI, really forced the conversation around the human technology relationship more than ever before.
Would it be possible for me to get a little water from someone?
I think so. I think we can run some water out here. Somebody by the speaker lounge. Yeah, and not only that, that reminds me of, you've experienced an amazing recovery. I don't know how personal you want to get about. It wasn't just, there was like health stuff going on also in that whole journey of, trying to battle through a lot of diversity. A lot of adversity in making Human Tech Week happen.
Yeah, I was actually quite sick at the time. And that first, 6 months of the year, I had a respiratory situation going on. And so, many people didn't realize I was sick, but I had oxygen in my purse at any moment because I might need it to breathe if I had a respiratory episode. And I was on steroids, and, if you sat next to me, you could hear, it sounded like I was whistling, just me breathing. So I remember the first time Steve was like, "What's that sound?" He was like, "Is that you?"
Is that an appliance in the kitchen?
No, it's me. And so actually the week after Human Tech Week, I had surgery, and now I'm good.
So not only were we building a plane while we were flying it, we had two hands tied behind our back.
Yeah. But I think we built something. I think Human Tech Week was beautiful, and that was the MVP. And now we're doing it again, May 11th through 15th, here in San Francisco. Woohoo!
Yeah, so let's talk about, and that was quite an MVP. Usually MVPs are like literally the original thing we were talking about, like 100 attendees and 20 speakers, and we kind of 10x that and then some.
Yeah.
So tell us about what your vision is moving forward. Like what does next year look like? Or it's this year already, so.
It's this year. I am so excited about this year. One of the things I've always wanted to do with events is after putting on events for 10 years, I really like where we are right now with this particular generation of this particular technology is that And many people talk about AGI with any of that, just in applied AI, to solve problems, to have some of the solutions that you have now. And then specifically for us, for, the idea of human change, about people really, changing so that they can reach their health goals or their work goals, or what they hope for in their community. Change has to be very personal. All of you, if you think about the times in your life where you changed, it's very personal. And so, what we have the ability to do now is the right solution for the right person at the right time with the right personalization to have human change. Now, that does mean there's a lot of, ethics and downsides and things that we have to be very attentive for. And also, and I'm in all of those conversations and take it quite seriously. And also the opportunity that we have to really make a big difference for humans, it's pretty extraordinary. So what we're doing with Human Tech Week this year is bringing together cities, other demand centers, developers, funding sources, pilots. Like, the goal of this year is to be able to actually match solutions to places that need solutions and bring in the funding to be able to execute that. So it's, I feel that we have a chance to make real change and drive real innovation for human plus AI solutions in health work in cities.
And you're at the highest level of conversations. That's when I had the opportunity to work with you, learn the conversation in the HR arenas with Sherm and some of your clients. So here, what we like to go deep, and I'd like tactile, sensory. Like, what do those conversations look like? What are the big organizations in the world looking at? Because we're talking a lot about the personal journey, and that's big. Just how do we interact with our AI that we're subscribing to, and then organizationally, whether it's a city-wide or an organization that's as big as a city.
Mm-hmm. Well, so one of the things that what Steve's referring to is I spend a lot of time also in the future of work. And one of the things, just to clarify, when I think about heal, grow, and thrive, what that aligns to health work and cities, so our society. And health has preventative health and wellness, mental, emotional, and social health in it. The second part is, education, workforce development, individual and organizational performance, and collective intelligence. So that's sort of work. And I actually started, when I started with we started with mental, emotional, and social health, but then realized that all of this stuff is connected. That's why Transformative Tech and Human Tech Week has the kind of scope that you don't typically see at other conferences. And then that third bucket was the built environment, cities, and that sort of thing. So the future of work is a really big one. And so I'm executive in residence for AI plus HI, so AI plus human intelligence, human ingenuity, human imagination for SHRM. That's the Society of Human Resource Management. And it's a really incredible vantage point because there are 340,000 HR leaders who take care of 362 million workers and their families around the world. And HR leaders are actually in the room for AI implementations. Like, they're in the room on all the decisions, and also they're the ones who are responsible typically for learning and development. So they're the ones who are responsible for fluency and all of the things that you need to successfully transform an organization. And then they're also in the crosshairs, because most people, when they think about HR, they're thinking about, like, oh, how do we get rid of that, right? or they don't really see it as it's uneven, the degree to which people see it as necessary. But, the future of work, and, work for me being a combination of, the dignity of agency, belonging, and livelihood. And like, what does it really look like? So I'm like deep into those conversations, and I get to see, lots of Fortune 1000, Fortune 500, and organizations of all sizes around the world, how they're approaching it. And I would say the real crux of the issue is this. This technology is completely changing competition. And so no one's going to stay in their lanes. So individuals don't stay in their lanes. Software developers are picking up product manager roles. Product managers are starting to do, early stage software development. No individual is staying in their lanes. Teams are not staying in their lanes. You're probably already seeing this in your offices where like people are coming over with, things that you used to do and saying, oh, what about this? Because of the way that the models absorb and allow people to get out of their lane, and companies are not staying in their lane. So companies that you didn't think were your competitors are going to be your competitors because no one's going to stay in their lane. So competition is changing. This technology is the greatest, the power, the organizing and orchestrating power that it has, because it's so horizontal. It's like nothing you've ever seen before. So it's removing friction. And those two combinations means that value is going to be, like how value is created is going to change. And so when we think about jobs, typically we think about a basket of tasks, but really a job is around value creation. So we have to jump to the next stage of being like, really, how does this change how value is created? And then the new jobs have to be sort of built on value creation, where it's moving to, because that's, not building it on value creation is building it on sand. And so, all of this is happening right now in real time. No one really knows the answers, but we have to iterate to it. And so we're going to have a full day just on, the future of work, and how to redesign organizations.
Yeah. So for the people here, if we want to bring it personal, everybody has experiences. Maybe we'll have some Q&A if we have time. But wondering, as an individual, if I was working at an organization of thousands of people, what should I be looking out for? Like, what are the pain points I'm going to be up against, and how do I mitigate those pain points as an individual?
I would say that the number one thing to do is to actually really think about how value creation changes for your company. And then if you're not there inside your company, migrate yourself towards value creation and how it's different and changes. And it's going to be different in different sectors, different companies, different types of companies. Easy is sort of like, where do sales come from? How are customers delighted? Those are sort of some easy ones to look at, but it's really a full structural shift.
So it sounds like everybody's going to have their own domain of KPIs, of performance indicators that they should be watching and reporting. That instead of working, generally it's looked at as teams. I'm wondering, that's what I'm imagining when I hear what you're saying, is that everybody's going to be basically responsible for bringing home the bacon for the organization they're working with.
Value creation can be internal or external. It really is going to be, there isn't going to be a silver bullet on what it looks like, and we don't know that yet. We don't know that yet. I would say one of the most exciting areas to me is I'm obsessed with collective intelligence, and I'm really excited about understanding and designing how teams and organizations and groups of people work with AI. I think one of the things that humanity has to do is we have to figure out how to have a human collective superintelligence. And so, this technology is the first step in all of us truly being able to work together, because email is not that.
Well, it sounds like because that's not what's being packaged necessarily right now and delivered. So it seems like that's incredible white space, is those collaborative applications where the LLM can look at you as a component of a team, as a valued member of a team, and do some of that team orchestration. Is that, if you're looking forward, if we're visioning what that future looks like, is that what you see a role that AI can play?
Absolutely. I think there's going to be, new companies, new processes, new spaces that we haven't even thought about. There's Eric Jocelyn, who's at the Stanford HAI, has got this great chart, and if you look at it, it's sort of like a box, and on one side something looks a little bit like an egg, and the egg says these are things that humans can do, these are things that machines can do, and then there's another one, it's sort of like the tension of machines sort of eating into human tasks, and then all the space in the rest says all the space on the other side are things that humans and machines can do together that we haven't even thought of yet. And but the thing is we have to iterate our way there. A lot of times when you go to conferences and you hear that, people sort of jazz hands and say, there's always going to be new jobs. What we actually have to do is we have to, it's like a flashlight that you can only see 10 inches in front of you. We are going to have to go through it 10 inches at a time. But the key is to do that very quickly. And that's how we'll iterate it to what the new jobs are going to be. I'm unwilling to let the market just, do it on its own at its own time. I'm, thinking about how do we bring together people who understand people. So neuroscientists, behavioral scientists, how do we bring together people who are on the application layer? So, CHROs, coaches, clinicians, people who actually touch people, and then also the technologist. So that, those three groups of people, we can iterate quickly and share information, so that, we can create the new health, the new jobs, the new cities. And that's what's going to happen at Human Tech Week. The other thing I want to tell you, because I know it's my time, is we have a great partnership with the UC system. And we just announced it last week. And so, that partnership is going to, bring the heft of a 10 university system to Human Tech Week. And then we also, with that are bringing in, different sovereign wealth funds and other organizations that really truly want to solve these problems. So do not miss Human Tech Week this year.
May 11th?
May 11th through 15th.
Through 15th. And maybe we'll wrap it with this so if somebody wants to get involved, how do people here, people who are speakers here that are appropriate for that, everything from organizations, people that want to create events that are part of Human Tech Week.
That's a good point. He's great.
What am I going to do? Can I bring this to Human Tech Week in some way?
Yes. Okay. So we're going to have partner events, and I'm really excited about this because I love setting the table and then inviting you in, all of you in, to express yourselves and the things that you're passionate about that are aligned with your individual and professional and business goals. So I'm inviting all of you to to apply to host an event at Human Tech Week. And so what that means is that, you get to, you get to create your own event. And I thought, when I was laying things out, I was like, oh, maybe we'll have 100. But we just started talking to partners at the beginning of December, and we already have 45 partners who are going to be doing events. Say it again.
Well, there'll be, I think there's what Nicole is saying is an opportunity to come create events. You probably have a venue that we might be able to bring those events into, or do people come up with that? What can the organization Human Tech Week provide, and what would that look like from a functional level?
So we are, so the core summits are going to be a bit smaller, because we're really getting into the weeds on activating and solving problems and getting those solutions funded. But we're also working with other locations. And so for especially the people who raised their hand early, we have some locations that we're in conversation with to make it very easy for you to book in for using those locations. And you work with those locations directly, but they'll be ready for you and no timing wise. And so, the early bird catches the worm. And then, if you want to do it entirely on your own, we picked a time in the city where the city is wide open. And so, salons, walk-in talks, workshops, you can charge, not charge, whatever it is you'd like to do on the theme of, human plus AI innovation and really helping human beings heal, grow, and thrive, and developing the solutions, that support that. And people are doing some really cool things. Like one of our partners is with MAPS, and they're doing a cool event on, they were like, we're really curious about hallucinations. And so they're going to have a neuroscientist talk about what hallucinations are in the brain, a psychedelic scientist talk about and a shaman talk about what a hallucination is in a psychedelic process. And then people who work with the models talking about, well, what is a hallucination, a model? And they're going to have a conversation about the utility of it and how should we think about that. And that also is a really good example of the 3 types of people that I mentioned that, need to come together across all of the issues that we see to be able to come to the solutions. We also have another thing called the Top 100 Innovations. So we're going to be doing a report, and you'll see us go out and ask for that. But we're going to identify for this next year, what are the top 100 areas that across health work in cities, that if we solve these things using human plus AI innovation, if we got these things solved, it would make a fundamental difference for people. But those are going to also be anchored in what demand centers like cities and hospitals and places across health work and society are actually actively looking for solutions in.
So I think we're at time, but I want to thank you for your work. Thank you for coming here. Thank you so much for your work. For what I love about everybody, but especially Nicole, is the work that she's doing to improve humanity and human thriving and collective intelligence, and having us all feel closer, come together.
Thank you.
So give it up for Nicole, and then you're going to make an introduction to our next fireside chat participants. So why don't we get those up on the screen? So stand up, one big hand, and let's get our next folks up here, coming over to stage, the left side of the stage. Come on up, we'll hand off our mics.
We have that.
Yeah, it should be. There we go. Oh, there they are.
Excellent. So it is my absolute pleasure to introduce to you Esther Dyson, who is a legendary investor, and Tatiana Kensabali with Open Health.
Thank you.
So nice to meet you.
Nice meeting you. Thank you for the beautiful
Esther, here you go.
Oh, great. Ron, where? I know. I'm glad I have
Got the sunglasses.
Yeah. I'm so glad to be on stage with one of my favorite people that we would even travel together.
Yeah, we went to Baku in Azerbaijan and saw an orphanage. Was
Yeah. I think the topic is very interesting. So we live like, we talk about AI, we talk about unlimited data, speed and everything. And Esther just submitted her book to the publisher, a new book. And it talks about something that we should be thinking, but we don't, and it's term limits. And my first question will be, can you just explain to people what does it mean?
Yeah. So term limits are fundamentally the notion that nothing is so good it should last forever. And the correlator to that is nothing is so bad, vanished from consideration, not, you know, can understand it, what made it happen. Are there any redeeming features? Are there babies in the bathwater? All this kind of stuff. More specifically, what actually happened was I had a 10-year nonprofit. Could talk about it at length, but I won't. And it ended almost on time, December 42nd of 2025. I mean, sorry, of 2024. And then this last year, people had been coming up to me saying, Esther, this is awkward, but I hear Wellville has ended. And I said, yes, it was supposed to. It doesn't mean it's gone forever. We had some impact. The stuff lives on, but it was a project. Our purpose was not to make 5 communities depend upon us, but to the contrary, to help them build stuff of their own that they owned and that they could continue and sustain. And then, of course, there was a certain guy who refused to resign, Joe Biden. There was another one who died at the age of 100-something. And, you know, that was not a tragedy. Celebrate the guy's life. And I kept thinking about this concept of term limits and thought, it's an interesting way to look at stuff. So the basic idea is humans are finite. And that's actually a benefit. It enables us to, you know, if I thought I was going to live forever, I'd have to learn every language. I'd have to have an incredibly long list of things to do. I know I'm not going to live forever. So just, you know, find a few priorities, focus on what you would do if you were going to die next week, next month, whatever. But just, you know, don't fail to enjoy your life, but also don't waste it. And that very finiteness is what gives it its value. And at the same time, it's really important. What did you get from your parents? What are you passing along? And what are you going to leave behind? Because you're finite. The universe, for all practical purposes at least, is infinite. And you're part of that. So you want to contribute to it without imagining that you're necessary to its continued existence. And by contrast, we're living in this world of immortality, obsession with exponential growth. Too much ain't enough. We need more profits. We need more TAM. Shout out to Paolo. You know, there's more to life than TAM. There's the quality of whatever it is you're doing. And it's this concept of couples counseling. Couples counseling is not about that thing that, you know, no, it's about your reaction to that thing. And we need to understand AI so that we can manipulate it properly rather than let it manipulate us.
I think you mentioned What? Close.
Yeah.
Okay. So I think there is always like a timing, a stage of life, event, something that triggers thinking. And is there something in your life that helped you to explain to people? I know it's like made personal, but I don't know what led you to.
Well, again, it was the end of Wellville. It was, I mean, my whole life I've seen people come and go, and but it just seemed that right now we're in this period where people just are obsessed with efficiency and the quantification of everything. Oscar Wilde quoted, he knew the price of everything and the value of nothing. I'm on the board of Charity Navigator, and we want to make giving more efficient. But, maybe giving shouldn't be totally efficient. It should come with love. It should be with people rather than, oh, I spent $40 billion on this thing that will benefit humanity. No, I spent some of my own precious, valuable, irreplaceable time working in a soup kitchen and actually meeting these people. What's interesting, writing this book, I've actually become nicer because I've given some of that advice to myself and discovered it really does feel good to. One more anecdote, and then and to
Remember
make
how we
sure
went
to talk about healthcare while you're doing this. I was in India. Long story. Happened to meet Narayana Murthy, who was the founder of Infosys. He invited me to dinner at his house and said it's quite modest, but of course my children have a house next door, and it was indeed modest. His wife served the meal, and we talked about his life growing up in the village as the richest people in the village. And he said, when hungry people came and knocked on the door for food, we didn't hand them food out the back door. We invited them to join us at dinner. And I just love that story.
Yeah. And I think we both experienced when we went to orphanage, right?
Yes. She was brilliant. Again, instead of she did send some computers in advance, and half of them fell off the truck, unfortunately. Laugh. But she also brought 200 little, they looked like ball pens, but they were actually bubble blowing things. And the orphanage people called off the classes for the afternoon, and the kids ran around blowing bubbles, and it was amazing.
Yeah. Now, there is another thing that, I was doing a lot of research on your upcoming book, and one of the terminology that they introduced was first I had to think about it. What is information diabetes?
Okay.
They're shifting gears, but to me it was.
And this is one of the dangers of AI. So we have we have diabetes, sugar, ultra-processed foods, the kind of stuff they serve often at buffets of women's health investment events, croissant and ultra-processed junk. It messes with your metabolism. Information diabetes is ultra-processed information and communications that mess with your information and your emotional metabolism. And then there's money you get from basically making money off a large TAM, selling something that's not good for people. And that destroys your moral fiber. And we're living in a world where babies through evolution grow up and they have this theory of mind. They understand, oh, when I cry, mommy gets annoyed. If I smile, mommy smiles. I'll try smiling, and then they understand what it's like. They get some sense of how mommy feels when she's smiling. Theory of mind. What evolution hasn't really given us is theory of business mind, which is more abstract. Why are these people in the store being nice to me? They're not mommy, but oh, they're being paid to extract money from me. And I mean, the real danger with AI is the humans behind the business models that then control the AIs in some form or other. And understanding how that works is key. And understanding how you can manipulate the AI rather than have it manipulate you is important. And in the end, people talk about predatory AI, but the AI or the business models, they're really not trying to kill you. They're trying to keep you alive. They are parasites. They want to continue benefiting from your metabolism. They're, but please keep subscribing. Don't die and go away.
So I understand the concept, but we have to consume all that data. Otherwise, we will be behind. So what you're trying to convey...
What do you mean consume all the data?
I mean, if I'm not reading my ex, Facebook, all those newsletters, I feel like I'm behind. Something is happening. I'm not part of it.
And you're letting the AI manipulate you. I mean, seriously, because doesn't it matter more to you how your friends are feeling than what some influencer is doing?
Right. So my question is, understanding that the environment kind of forces us
it's
to
our fitness. It's our
participate, right?
fitness function in society, and we should reject it.
And how like, is it like, okay, I'll set up alarm. It's 12, and till 12:05, I'm reading this thing, and then I'm going and hugging my friends. I mean, how you suggest like people manage? Is it first like to explain to people, this is what really happening, this is your set of values, and then you need to come up with like framework on how you...
Yeah. I mean, the real solution to it, honestly, is mandatory parent training. I don't think that's going to... Yeah. A more nuanced approach is helping people to understand this and helping them to... I mean, we do need better parenting. All the money we're going to save and all the time we're going to save by automating so many things. I had an argument with Vinod Khosla 2 nights ago. We don't need... Doctors do more than diagnose. They are human beings, and we need more humans being trained to do human jobs. When machines came in, we didn't need strong people. We needed intelligent people. Now, in a sense, we don't even need intelligent people as much as we need people who understand people both need people and need to be needed. That's what creates our humanity. And it's not giving someone a curriculum. It really is having people who love them and who need them to love them back.
Mm-hmm.
It's one of these, the chicken and the egg. We need to somehow get society as a whole to understand this better and to start respecting teachers and community workers and all this stuff, and focus less on money and efficiency. And
Right. So going back to, I think everyone on the back of your mind, like, what should we teaching our kids? What jobs, what roles will require humanity, and how that will like implicate the whole path of education? And
I'll answer, and then maybe also we should do audience questions. I mean, this is the problem. It's the solution is simple. Actually making it happen is much harder, but helping people to understand that there's honor and value in humans, and we can quantify the efficiency of all this other stuff, but how much value does it have? I mean, half our GDP is stuff that adds no value. All the PBM revenues, all the money spent for guns, the money spent for cryptocurrency, it creates financial money, but it doesn't create actual value. And we have too much people making money by making transactions, but not by actually producing anything of value to people.
But we can't measure, right? Can you measure impact on your health, me hugging you?
We can't measure it, but we can feel it and know it. And
Right.
I mean, again, the challenge is to get people back to experiencing that kind of stuff and understanding how much better it is than the ultra-processed version.
Right.
I mean, I get ads. We can save you time by interviewing your parents so that when they die, you can talk to their avatar. Yeah, really scary.
I do want to take audience questions, so we have enough time for.
We can't see you, by the way.
Yeah. So,
Are you there?
If you have questions, please
I'm always here.
raise your
The
hand.
voice from the rafters.
Okay. Any question?
Alex has his
over
hand
there.
pointing.
Okay.
Hi, Esther. I'm waiting for your book to come out, but you mentioned parents should be trained. Are there any, lessons in your book? I mean, I'm a, father of 3 daughters, 6, 10, and 15, especially 6 and 10 at a very critical age. What should I be doing right now?
Yeah. So I'll be honest, the book is not 10 timely tips. Because there's lots of advice and most of it's good and hard to follow. But the fundamental thing is talk to them. Don't be on your phone. There's secondhand smoke and there's secondhand. If your parents are on the phone, you're going to be on your phone. Foster their curiosity. Read Alison Gopnik's book, The Gardener and the Carpenter. You're not a carpenter of your children. You can't construct perfect children, but you're a gardener. Give them, don't give them fertilizer, but give them healthy food. Give them questions. Give them love. Let them read Jonathan Haidt. Go out and let them experiment and learn what the world's like, and let them fight with each other. My brother and I are very, very close, and we always used to fight. And
Same here.
yeah, let them, but help them be human and not get consumed. And there's encouraging stuff. Taking phones away from kids in school, they're discovering, oh my gosh, they talk to each other at lunch break. How wonderful.
I just want to add that we can't ignore what's happening, right? AI is everywhere. Kids have the, devices they talk to, but I think it's very important for us to explain to them and develop critical thinking, and also being able to not trust all the content, especially the more we're moving with, where I can take anyone's picture and voice and create whatever I want. So it's our responsibility to explain to them. We need them to be out there and do human things, but they need to understand the environment they're growing in right now.
Yeah, and genuinely help them understand business models. These companies are trying to make money, and they're trying to make money so that some guy can get rich, and they're also trying to pay the employees a little bit, which is why the employees do stuff that they don't really believe in, which is really, half or more of the whole healthcare system is burned out people who are being consumed with soul-destroying paperwork, who came into this business in order to help people. And we're here at a healthcare conference. I think the healthcare system should be a leader in changing that. Keep your own employees healthy and happy, and help them get rid of the paperwork so that they can spend time with the human beings that they want to serve.
Yeah, but again, we both we're trying to make changes in healthcare. The more effort you put in, you understand that underlying foundation is just so bad that encourages
It has its own
business
business
model.
model.
Exactly.
Because we see healthcare health is a public asset. Health is like the BART system. It's like our road system. It's like the land. And we look at it as something that belongs to individuals that they're too stupid and lazy to take care of. But no, we need to start investing in people instead of spending on repair jobs, which is what, unfortunately, most of healthcare is. Wait until they get sick, then they become profitable.
But look at all the announcements. If, God forbid, some famous person gets ill and dies young at some kind of bad disease, if you look at all the posts, it's like, oh, we need to develop more drugs, or we need to come up with early diagnostics. All great. No one is asking why that person got it in the first place.
Yeah.
But, ideally, we want to prevent. We want to stay healthy, but everyone else makes money when we're all a little bit sick, right?
And suicide, whatever, we can get gloomy and accurate that there's a mental health crisis. COVID, phones, all these things interact and accelerate one another.
In all the pressure that you talked about. So we're not explaining to people the value of humanity, being human, being imperfect, and all that
unique,
pressure.
And unique.
We all make more money, buy another car, and your startup has to double and triple and 100, and otherwise there is no, and all that pressure.
But again, we've eliminated, people have audiences and followers. Let's have friends.
I see a question.
Yeah, so knowing both your work for years, I'm very happy to hear the discussion. I'm a long-term futurist, deeply believe in ethical usage of technology. I love what you talk about parents and the kids dynamic. I like to invite you to expand a little bit further in each of stakeholders, currently corporations, government, countries. There's such a rapid speed growing currently in Gen AI, how each stakeholder can play, in terms of ethical usage of AI that actually empowers humanity.
It's not just how you use AI, it's your entire attitude about everything. We need a society that is better informed so they understand what's going on, so they can vote for policies instead of basically voting the way you vote in a TV contest. We need politics to be more about policies, less about people. We need somehow to get depolarized. And writing this book, again, I learned a lot of stuff, and there's a lot of stuff I'm learning now that's not in the book. This whole notion of approval voting, where instead of you vote for anybody you think would be a good person to be in charge, even rather than it being a contest between two people and the other guys are enemies, it's more you're encouraging the people who run for office to try and attract the largest group of supporters, so that they're not trying to go out on the edges and alienate everybody else. They're actually the kind of people who want to be president or governor of all the people in whatever it is that elected them, rather than just trying to get the majority and get rid of the others.
Yeah, I had very interesting discussions on the theory of ideation, like why some ideas or some things pick up and the others don't. And there is a science behind it, and it handshakes the influence of those things on decisions we make, right? So who plants them, how they get viral.
And people need to be more aware of how that works so that it can't be done to them.
Yeah.
They can do it for themselves.
The only thing I want to add, I grew up in society where there are a lot of restrictions at the government level. We all found a way to do things we're not supposed to be doing one way or the other. So what I know that restrictions, they don't work. So we'd rather educate create environment where kind of, balances, but say, no, you're not using this, or you're not like that, might not necessarily lead to the outcomes, because people will still use it and not in the way you want them to do.
Any more questions?
Go ahead. So before she asks her question, I just want to say that it's very inspiring to see you two ladies on stage at the age you are, because we have such a gap in society with AI, from the younger people to the older generation who give us guidance. And I think that the new generation thinks they know everything. And if you guys promoted yourselves more to give that advice for where you're at, I think it's going to be very inspiring to people. So thank you both for being on stage today, and it's very much appreciated.
Wow.
And lastly, thank you. And lastly, I do want to say something. You're absolutely correct about health. I have a motto that your health is your wealth, because you can have as many cars as you want, as much success as you want, all the money in the world. But if you don't have your health, you've got nothing really. So the fact that this conference is going on and you guys are speaking is very inspirational. Thank you.
Oh, thank you. And it's funny because people, it seems like obvious, right? If you don't have health, nothing else matters. But people come to realize and act upon this simple statement is at the time where they get sick, not when they're healthy and they're wealthy. And that's kind of a paradox.
But in the end, health, what's even more important is the people you love. And you can be quite physically incapable if the people you love still are there. It matters, and it varies. And at the same time, it's that you need to have purpose to stay alive and healthy in some form or other. And again, this is the notion of the time limits. You don't need to do it forever. But most humans, they want to leave some of themselves behind, whether it's through a book, through the children they raised, through what they did in the community, and that feeling that you mattered. I mean, in the movie Her, Joaquin Phoenix has this wonderful robot girlfriend, but he discovers she has 1,500 other lovers. And it's like, no, I need to matter to you. You matter to me. It's got to be two-way. And this ultra-processed world fundamentally is bad for our mental health, whether we know it or not. Just the way, the food tastes good, but it's still bad for you. And these experiences taste good, but something in your soul knows that they're fake.
Any other questions?
Okay. Hi, I'm Maria. I'm building in women's health, actually. And I'm trying to fix what you were mentioning, helping health providers as well as women. What would you think that it will be one of the main things to focus, like the key that could change everything?
If there were one key that could change everything, I think we would both be building it. It's do your part. I mean, that's the point. You don't need to do everything. You need to collaborate with other people. And, there's this, again, the financial world says, I got to be number one and control the whole market. And the real world says, I need collaborators. I need to do my part and help the other people do their part. So do the bit that excites you the most, and then find other people to do the other bits that are complementary. And most good advice is either given to an individual that you know, so you can be very specific, or it's advice like my advice, which is figure it out for yourself, but do what you believe in. And strategy is good, but so is what am I good at? And that's what you should be doing, because you'll do that better than the other guy, and they can do their thing.
And that also leads to another question on, and I think you kind of mentioned a little bit about people realizing that at some point there is a transition, right?
Yeah.
And I think not too many people are good at setting up, like realizing when is the good time, right?
Yeah.
Usually they say, oh, for people in sports on the peak of the performance, but in business it's not that, or in politics.
So I want to say one other thing, because I heard someone else be asked, what they invest in, and I'm a single person. The great thing about investing your own money is you can put in what you believe in, because you're not losing other people's money. You may lose your own. I invest in things that I know I will learn from, and then I hope to make a little money off that too sometimes. But the point is that I don't allocate my money to a banker to take care of it. I invest precisely so that I can help an individual with an idea. And, that lives on. Yeah, I want enough money to live on. But never take a job for which you are already qualified, because you won't learn anything. And never, if you're lucky, and obviously you need to be slightly lucky, never do anything you wouldn't do for free, but try to get paid. And if you can do those two things, you'll have an amazing life. And it will end, and it will have been worth living.
Okay.
Just like this panel, right?
Yes. Thank you so much. Always a pleasure.
Thank you.
Thank you one more time for Esther and Tatiana. Thank you so much. And next up, we have Dr. Mohammed Jamal. Come on up and take the stage. I got a clicker for you. Yeah, that one's forward.
It's a 10 minutes. Hello, everyone. Myself, Dr. Jamal, and as an entrepreneur, this will be my first talk, and I would like to thank Steven for this opportunity. I'm sure many more will come, but first love is always important. So thanks again. Oops. And oops. It goes always forward, no backward? Okay, got it. So I'm going to talk on proactiveness and longevity. So longevity and early detection are deeply personal to me, since I lost my mother in very young age. Because of late detection and a reactive healthcare system. That's why mission of my life become to bring early detection to everyone, not on the state or nation level, but global level, so that we can touch the billions of lives, whoever need it. And we will see how we carry on. So I started my journey as a PhD student who work on a systems biology-oriented cell cycle research, which has a direct implication in cancer. Followed by that, I work with Cincinnati Children's Hospital on a leukemia, and then University of Wisconsin-Madison in prostate pancreatic cancer, skin cancer. After that, I got opportunity to become assistant and associate professor at King Abdulaziz University, Jeddah, Saudi Arabia. So I moved there. I developed multi-million-dollar projects, multiple in the area of cancer. Then, because of my family reason, I moved back to Michigan. There I joined Wayne State University. There I work on some gene therapy project. And during all this period, I thought to opt for entrepreneurship as an option to achieve my goal. And that's where I launched my first startup as a BioViz Laboratories, as a R&D and diagnostic lab. While into a diagnostics, I came into longevity, wellness, anti-aging diagnostics. While exploring the diagnostic world in the space of longevity, I come across like people are juggling with several very, very good platforms for different reasons. For example, lab tests, supplements, wellness products, personalized guidance. And that's where I realized like this is a big opportunity, a big problem, and big problem brings big opportunity. And the opportunity for me was to serve the people in terms of like taking care of their diagnostic, especially in early stage. So what I understood in the problem for the lab test, for example, cancer test, cancer lab, microbiome, micronutrient, all these different tests, people go for different specific labs. Once they get the result, they go for supplements and various products. Now AI-based other alternatives are emerging in the sense of taking care of like sleep wellness, mental wellness, skin wellness, cancer detection. So I realized like it's not easy for an individual person, first of all, to understand the science of all those diagnostics. Like we are 1% or maybe less than 1% who are in this specialization. So 99% has to be served. So they need to understand, or they need to be having a platform where they can get everything. That's why we build Vitalistic. Vital is health, life, wellness. Holistic is complete, where we bring every kind of way of taking care of their longevity journey. So they can have the AI assessment, they have expert guidance, they can have lab, supplements, wearable device integration, so they can optimize their wellness journey. And how it's gonna work, so wellness clients can go for AI assessment, followed by AI agent will guide them for the respective lab or respective provider. And those provider will further guide them for lab tests. And those lab tests, once we have, and their history, and their previous or their family history, or whatever medical feedback loop mechanism, and so on, they're gonna have their wellness journey, achieving their goal, whatever their problem is, to address this. On a back end, we will be having a team of wellness coach, scientists like us, provider, trainer, everyone who is syncing with their needs. So for that, we have partnered with various labs like 3x4, Spectra, Proteus Health, Genova, DDI, Cyfox, True Diagnostics, and there are many more. And that's what our portal is. We are Vitalistic. They can come and go for AI assessment, which is still under progress, but they can go for lab tests, supplements, and products. These are like some of the example. People can go for like comprehensive blood panel, True Health, comprehensive hormone, wellness panel. Recently, we have secured a US exclusive marketing right from Predomics for Oncoverix. Oncoverix is a multi-cancer early detection are dying globally. If it is diagnosed in early stage, like 1 and 2, 90% of them can get the survival. But unfortunately, still, there is 60% people are detected in late stage. So that's where AI-powered, this metabolomic-based MCED works, which is developed by Predomics. And how it works, so blood sample, we isolate serum. With the serum, metabolite extraction, run through the LCMS, and then this gives a signature metabolites. Those run through AI, and then AI detect like cancer negative and positive, and what kind of cancer types it is. So this is a game changer in the space of multi-cancer early detection. Why? Because we just need 1 ml compared to others who seek multiple or 10 to 15, 25 ml. We can snapshot 55 different cancer types, and we can have a result in by others. And 98% of specificity and average, and this have been tested already in 20,000 sample. And the best part is we can detect this in a stage 1 and 2 with 90% accuracy compared to others, which can be 17 to 64%. So beyond cancer, we are expanding on various other by joining with multiple labs. One of them is Peptides Health we are bringing soon. We will be working on neurological, metabolic, and longevity optimization, other different tests, which can be very, very crucial for early diagnostics. So having this momentum, we would like invite you all to join so that we can make this movement and help billions of people across the globe. Thank you very much.
Did you want to ask questions? Dr. Mohammed, do you have questions for us?
For you.
Anybody have questions? I know that, Alex. Thank you. Anybody have any questions? We need to. I appreciate you.
Sure.
Good stuff, and we need people to bring all this data together. And I love what you're working on.
Thank you.
A big hand, Dr. Mohammed Jamal.
Thank you.
Okay, next up we have the slides up there. Let's bring up our next panel. From early stage fundraising to building successful businesses. Is that what's next? We have our panel coming up. One. Yeah, good to see you. Let me give up all my mics. How are you? There you go. Okay, take it away.
Okay, welcome for the people who really want to know how to build a big company. How many of you wants to build a unicorn? Raise your hand because we can't see anything here. Good, most of the audience. What about the other people who just want to build a failure company? Come on. Okay, now that we got your attention. So I'm Amanda Gist, and we're self-appointed myself as the moderator, but we're going to get a lot of fun. We're going to try to keep time for questions. So what we thought we're going to do is to ask each of the panelists, me included, to say what's our background and what are 2 key lessons we have learned in building scalable companies in health tech in particular. So my name is Andy Gist. I started the space called health tech in 1986. How many of you were born? Yeah, most of you. Okay, good. You're awake. And one of the things I did is to say traditional medtech and biotech is a high product risk going after an existing market. Health tech is exactly the opposite. It's technology is not that difficult to do. It's computer software. It's all about changing a business model. It's all about the market risk. So I've basically got smarter lucky to have had 4 IPOs in health tech. I've built companies that became unicorns. So my wisdom to share back with you is that it's all about defining the problem. Don't fall in love with your technology. People don't buy technology. They buy a solution to a problem. Health tech in particular is all about the business models. I will talk more about this. So I run a group called Health Tech Capital. We have invested in 65. One of them that just went public. So I'm going to introduce my next panelist, which is Renu, who is kind of early stage venture studio. So how does that work?
Yeah, great to be here. Thank you so much. And so I'm Ritu Gupta. I am Global Head of Partnerships and Initiatives at Maroon Research Institute. We are We are focused on science-based solutions for health span, which is not only living longer, but healthier. And we are global in nature. We are more upstream from many of the solutions you'll hear about. So we are focused on prevention, prediction, diagnostics. And when we think about that, what we are prioritizing are population health, chronic diseases, so like brain health, which is, like, just to give you a stat, like only 6% of all healthcare expenses going in brain health and neuroscience, and it's only 3% globally. So, our brain is a very important organ, and we want to change that. We want to make sure that there are more successful solutions in supporting brain health, for example. So we have a global longevity venture studio. We are currently going through applications. We have more than 500 plus applications throughout the globe. Very excited. The companies are from anywhere from pre-seed to Series A, if you want to think in the venture kind of framework. And we will be launching it in February. So the way we work with these companies, early stage companies, is to support them.
So what have you learned that makes them fantastic at scaling up?
Yeah, great question. So one of the things we have seen is, especially in today's age with new technologies, AI, ML, innovation is getting faster. Anyone can go to Lovable and create a website, right? So there are a lot of Me Too kind of solutions, or solutions that are slapped together. The companies that are going to be successful are the ones who are continuously innovating. And they are looking beyond their little silo or the little geography they are in, but looking globally, because all this technology is...
Think big.
Think big, continuously innovate. And what's happening is, what happens when you are a small startup, you've invested in many, you don't have the resources of a big company to have the R&D function and resources. So that's where we come in, and we help them with that R&D resources through the partnerships we have, as well as the experts we have in the house. I'll say a second one if you want me to.
Yeah, go, and then we go to Daniel and then Andrea.
Yeah, the second one I would say, which is a cliche, is the team. As you are growing, because we see companies from pre-seed to Series A, think about who is going to be in your team in different functions, who is going to be leading your team. Sometimes it is the founder at Series B, Series C. Sometimes it's not. So think about the team.
Okay, So we have the angel here, and you and I are angel types, but so Daniel, from your perspective, they come out of the studio, they come to you, and what do you look for to write a big checks? What's your expertise in saying this is the unicorn coming up?
So just to give a little bit of background on myself. So I didn't start my career in healthcare or health tech. I'm an inventor. I was very fortunate to have a few big successes and eventually got into investing. And once you start hanging out with more family office kind of people, the people that invest in venture capital funds and new innovations, you realize that behind closed doors, really the only conversation that's happening is how do you live a longer, healthier life? And that's what originally piqued my interest in health tech, particularly, but also healthcare, broadly speaking. In terms of what we look for, so as a family office, we do not operate necessarily like a venture capital firm. We do not have a dozen analysts to keep track of every single new innovation in industry. So a lot of what we look for are things that can be deduced down to fundamental technology and first principles. So the first thing we ask for is not a pitch deck, it's actually your patent portfolio. And that's something that we predominantly review. Then we meet with the team and look for really the outliers. And the main thing that we look for are individuals that are in it for the long haul. We actually consider it a negative signal if somebody tells us they're going to IPO within 2 or 3 years. That doesn't happen. Anne knows this from experience. We want somebody that says, I'm working on a problem that's so important that I will work on this for the rest of my life happily.
Passion. Andrea, we have a little prototype, how do they scale up? What's your expertise?
Well, I would agree with both you guys, or all of you, is you have to think big. And you have to think in terms of problem and solutions, because people buy solutions. And many startups only think inside of their own box, inside of their own company, their own solution, and even inside of their own silo. So what you have to do is think of the end game from every other perspective other than your own, including a marketing perspective, commercialization, private equity, who's going to buy you and why. You have to outline the end of your story before you start your story. And I come from that perspective. I worked in big pharma for 25 years. I did the strategic planning behind 20 global blockbusters, Keytruda, and Lipitor early on, bunch in between. So even when you're a big pharma company, I would start the plans from the end game. How are we going to be a blockbuster? How are we going to win? How are we going to beat the competition? But more than that, I would change the ecosystem. Now, granted, I had big budgets and big teams, but I would argue as a small company, you have to even be more strategic and more clever, because you have a smaller budget, smaller team, but your story should be big to get people to pay attention. And along with that, you should start thinking in terms of collaboration, not competition. So what are the like companies that are in your sector that you can pull together? Start thinking like a private equity person. Who do you need to pull together to look and act bigger? And that includes the old system, because the old system has revenue, you don't. You have innovation. So part of when I consult these companies, I actually pull together different companies as a partnership and sell them as one that's more attractive to my investors.
Yeah, so to build what you heard so far is that you need to be a business architect. I think what Andrea just said is that what are you building in 5 years? If you don't know where you're going, you're not going to end up there. So let me explain a little bit what are the key characteristics I have learned from the team. The team is everything. In the early stage, they're the people that basically will drive the business. So 2 things. You have to put, how many of you are CEOs? Okay. You better be extroverted. You're going to spend 50% of your time selling. You have to sell to us investors. You have to sell to employees so they follow you despite the fact you have no payroll. And you have to sell to your first customer. So you better enjoy that, because that's 50% of your time for the next 5 years. The other key thing I learned, I'd love to get your perspective, is to have what's called a flexible mindset. It doesn't matter how smart you are. You're going to have to zig and zag. That means that you need to be stubborn, to move, but not too stubborn to kill the boat. And that's a very fine line that you define after the facts very often. And so the flexible mindset, we test that when you pitch. We disagree with you and we see how you respond. It's the ability of getting feedback from your employees, your investors, and your customers, not just incorrect. So I'd love to get the perspective of the other panelists to say, what's the personality of the leader that allowed them to scale to big companies?
Yeah, I totally agree with that. It is, as the CEO, you are especially in early stages, you are the brand. And I just want to build on the point you made about flexibility.